Okay. So, good morning. I hope that you are very well this morning after the perfect networking dinner last night. Thank you once again for organizing such a nice dinner. And after such a dinner, we're starting to talk about the health issues and prevention of the health. And I hope that this morning we have a very nice discussion talking about sustainable health and disease management, the topics of great interest for our alliance, but for great interest for community in general. So five great experts in this topic will just present some results, and I hope that we will have a very fruitful discussion after that with the questions. Yesterday we see that the audience asking lots of questions, so hope this morning will be the same. If you not have the questions, I have few, so we can just continue with discussion. So order of presentations like a life, coming from the childhood to the old age, but we don't have the old age, but from the childhood to more technical details and more technical aspects of the health continuation and the issues. So first, it's my pleasure to introduce Professor Birute Strukcinskiene, Head of the Public Health Department at the Faculty of Health Sciences in Klaipeda University in Lithuania. And shortly, Professor Strukcinskiene is also Vice President of the Injury Prevention and Safety Promotion section at the European Association of Public Health. She is Professor of Medicine and Health Sciences and Medical Doctor specializing in pediatric trauma surgery. She has authored or co-authored more than 200 publications and 10 books and textbooks, and her research interests include injury prevention, safety promotion, stress management, health and well-being, healthy lifestyles, and the health and safety of children and young people. So please join me in welcoming Professor Birute Strukcinskiene in the first presentation this morning.
Dear Moderator, Rectors, Vice-Rectors, Heads, dear colleagues, it's a honor and pleasure to meet EU-CONEXUS community. And today, I would like to introduce to you our study on child safety. Childhood injuries to society is very important. And preschool and primary school age is critical and important stage of child development, because in this period you can formate for him skills, abilities, and especially important, you can formate for child attitudes and approaches to health and safety. And recently, injuries is the first cause of death in children in Lithuania. So preventive initiatives and strategies in this age are very important to reduce mortality and ensure the safety in children. I would like to introduce one of our studies on where we aim to analyze attitudes of parents of preschool and primary school age children on injury prevention and safety promotion. The survey was performed not so long ago, and we investigated parents and caregivers of preschool and primary school children in Lithuania. We investigated parents and caregivers of children aged 1 to 10 years. So we could compare two groups, preschool and primary school children. The study revealed important results, that 75% of parents believe that accidental injuries have a significant impact on children. But what is very worrying, that only half of respondents, only half of parents know and believe that children's injuries are preventable, that we can prevent injuries. And parents, caregivers mentioned that most common type of injury in children was falls. And also, what is when they are wrong, they believe that main cause of death are diseases, not injuries, and that boys and girls are equally like to get injured when participating in the same activity, what is as well wrong, because boys are nearly 3 times more often are injured than girls. So we see that parents and caregivers agree that they need to educate children about injury prevention and safety, but we need to educate themselves. However, only 1/3 of adults are very concerned about their children's accidental injuries, what is also big note for us, because it is only 1/3 of parents. We need to have then nearly all of them that they would be concerned about children's injuries. So, we concluded that parents do not have sufficient knowledge about childhood injuries and that more attention should be paid to their education about child safety promotion, and then more educational activities about child injuries, injury prevention and safety promotion need to be organized for both parents and children. Thank you for your attention.
Working? Sorry. I'm not usually using these mics, so thank you. And the questions will be after all presentations, so thank you for this first presentation. Prepare your questions for later. There is lots of parents here. Some have some situations with the children injuries. Last week, I'm watching my colleague from Zadar, so maybe she will ask some questions. So thank you, very interesting presentation. So the second presentation, it's about health promotion and education and the focus on the Blue Health and One Health. So it's my pleasure to introduce Professor Ingrid Arnaudin, full professor at Biochemistry and Therapeutic Biotechnology at La Rochelle University in France. And Professor Arnaudin holds a PhD in biochemistry and is a senior scientist whose work focuses on developing bio-inspired solutions using molecules produced by natural resources, particularly in oncology and nutrition. She has published more than 95 scientific articles on the biological properties of oligosaccharides and peptides derived from algae, microalgae, and marine bacteria. In addition to her research, she is actively involved in European training initiatives and participates in numerous European and national research programs, including collaborations with industrial partners, and she is one of the great participants in EU-CONEXUS research network and research area. So please join me in welcoming Professor Ingrid, please. Thank you.
So thank you very much, dear colleagues, dear panelists. Good morning, everyone. So first of all, I would like to thank the host institution for inviting me in the panelists on this round table dedicated to sustainable health and disease management. Given the field of my scientific expertise, as you said, dealing with the valorization of natural substances from marine or coastline origin, valorization in health and particularly in the field of the breast cancer, and the thematic of this challenge, I decided today not to expose you part of my research, but rather to share an opinion or my opinion in order maybe to open a debate of what we can call blue health and one health, or blue one health. We can also fusion and merge these two concepts. So, as you know, 70% of our planet is covered by the ocean. And for decades, we have seen the ocean and coastline mainly as a resource. But today, science and our science remind us that the ocean and coastline it's much more than that. It's a living system that sustains all life and sustains our health. If we consider now marine biodiversity is not just an environmental issue, but it's also a health issue. And the two concepts, blue health and one health, show us now that the well-being of humans, animals, and ecosystems are deeply interconnected. In other words, if we protect marine life, we protect also our own life. So it's true that marine biodiversity supports human health. As you can see on this slide, I made the choice to mention 4 topics able to answer to this question: how marine life support us. First, as you can see, it acts as a natural regulator by filtering water, storing carbon, and controlling pathogens. Second, it brings us sustainable food. Coastal and marine resources provide us healthy proteins, essential omega-3 fatty acids, algae, and so on. And third, marine organisms could produce, and in the field of my expertise, marine organisms could produce anti-cancer, antiviral, and anti-inflammatory compounds, and don't forget that some of which are already used in modern treatments. So finally, let's not forget, it's for you, let's not forget the psychological and social dimension. Coastal environments have been proven to reduce stress, improve mental health, and enhance community well-being. Unfortunately, as you know also, you know that marine health declines, so does ours. Pollution by plastic, by chemicals, leads to contamination and habitat loss. Overfishing and habitat degradation also disrupt ecosystem balance. Concerning climate change, you well know also that climate change accelerates coral bleaching, for example, ocean acidification, and disease proliferation, like zoonoses, for example. And each loss of biodiversity weakens resilience and natural protection, so affect also sustainable health. So, the science conducted with our alliance, EU-CONEXUS, on all these subjects provided now us many knowledge. What we need, to my opinion, what we need now is more collaboration. We said that in a strategic workshop yesterday, and action. And with our different joint research institutes, for you, Ilinka, with the different joint research institutes, I believe now that it's possible to foster interdisciplinary research, connecting, for example, biology scientists, medicine scientists, medical scientists, and social scientists. And yeah, we take some example of what is possible to collaborate in order to answer to these societal challenges. We should, to my opinion, we should promote sustainable bioprospecting and ecosystem restoration. We need to integrate marine biodiversity now in public health strategy, and we have to protect our marine biodiversity because, like I said previously, it's also a way to invest in public health. So also in conclusion, when I have in mind the talk I want to give you this morning, when I'm thinking blue Earth, when I'm thinking One Earth, when I'm thinking blue One Earth, several ideas for scientific collaboration came to mind. To illustrate these two concepts, I want to focus on today in this panelist, in this round table. if in our alliance you want, for example, to conduct sustainable bioprospecting, it's maybe in your best interest to create a consortium of marine biologists and pharmacologists or biotechnologists, and we have this type of expertise in our joint research institute. So we are now to build a consortium in that way, if this field is of your interest. If, for example, another example, you intend to monitor marine zoonoses, maybe it's your best interest to associate ecologists for our GRI to epidemiologists in another GRI. And if you want to design blue spaces, for example, for mental health, it's a great preoccupation, and it's a national preoccupation for France this year. You may be associate psychologist with urban planners, and I think you have to find it in different joint research institutes. And another example, if you want to monitor evaluation of the health benefits of biodiversity, maybe it's your interest to associate economists with a coastal manager, and so on. It's 4 examples. And I believe that is by combining the different areas of our expertise in various joint research institutes that we'll be able to meet these challenges, the challenge of promoting health and managing disease, and of our coastal societies. So hoping that we'll be convinced now, and thank you for your attention.
Thank you. Thank you for one more interesting lecture this morning and presentation, and I think there are lots of questions here, and there is a lot of potential for cooperation, not more cooperation than questions after this one, and thank you for suggesting this cooperation and interdisciplinary research, which is the main hope of the main scope of this alliance and main scope of this research council, and even the conference rely on this interdisciplinarity. So the third lecture presentation is going to water pollution and environmental quality, and it's my pleasure to introduce Professor Tränckner, Professor of Water Management at University of Rostock, Germany. And Professor Tränckner has a background in land improvement and environmental protection from the University of Rostock, where he also completed his doctoral dissertation on plant-wide modeling of wastewater treatment plants. Before joining academia, he was team leader in drinking water treatment and distribution in Dresden. His research focuses on interface between urban drainage system and receiving water bodies, process integrated industrial wastewater treatment, and the recovery of energy and nutrition from wastewater. He is also a member of the Leibniz Campus Prosperous Research and the Department of Maritime Systems at the University of Rostock. Please join me in welcoming Professor Tränckner. Please, Jens. Okay.
Yeah, good morning. I'm also happy to be here and have the chance to present my ideas on water pollution and human health, or health more general. What you see here is the current assessment of water quality in Europe according to the Water Framework Directive, and you see in the orange bars is a not good state. So we see that in the surface water the chemical state is in most cases not good, and also the ecological state. If you're looking on groundwater, it looks a bit better, but still we also have here see that the chemical state is not always good, and also the quantitative state. What are the reasons? If we are looking on surface water, a lot of the pollution comes from atmospheric deposition, and this comes basically from burning fossil fuels, and a lot of this assessment comes from mercury. But if we are looking at where we can act, then you see also other diffuse pollution, namely agriculture, with 29%, but the point source solution, meaning wastewater treatment plants, is still available, but you see is in a lower priority. In groundwater, we see diffuse pollution, and a lot of this diffuse pollution comes from agriculture. And I will go on that. If you see the assessment over the states or the countries, you see the clear driver is, in most cases, population density. So where we have a lot of population, we have the worst conditions, and this is very often also related to industry. What you also see a bit is a mitigation in those countries where we have a high net water balance. So you can say somehow dilution can be some kind of solution, but of course not a real solution. But this is also biased by a heterogeneous assessment by the countries. Coming to agriculture. So I'm not the expert in agriculture, but agriculture is really a big driver impacting water quality, namely groundwater quality, and the two main issues are the excessive use of nutrients and also pesticides. But agriculture is also by far the highest net water consumer and contributes also a lot to water abstraction and affecting also the quantitative situation. In that sense, you could say agriculture is both victim and driver also of climate change. Nitrate is a big issue, and nitrate comes mostly from agriculture, so it has a direct toxicity. So the concentration, limit concentration of the World Health Organization is 50 milligram per liter. And no wonder exactly these 50 milligram per liter is also the limit concentration in groundwater according to the EU Water Framework Directive. And if you exceed this concentration, you cannot use the groundwater for drinking water purposes, at least not easily. But it also has indirect consequences because of its high redox potential. It mobilizes heavy metals, for instance. So nitrate reduction is really a big issue, but so far we haven't solved that problem yet. Phosphorus is also a nutrient, and what you see here on the photo is dead fish in the Baltic Sea. So it's very recent, so it's from October. The reason was or is also eutrophication of the Baltic Sea, and in that case it was then related oxygen depletion, and this is really a big issue. But on the same side, so we pollute our water with phosphorus, but phosphorus itself is a limited resource, much more limited than oil, let's say, because if it is empty, there's no replace. And at the moment we have only, so we have about 300 years left, but then our resources are empty. And this is a big issue also in water treatment, so we have to recover the phosphorus as much as possible. First, of course, we have to remove it, and then we have to recover it to bring it back into the cycle. So this is one of those things what we are doing. Another big issue, PFAS. We use it everywhere. I think some of you already used it today by using these cups drinking water, it is yes, everywhere used because it's water repellent, but it's a very tricky chemical. So it is persistent, so it cannot be degraded, and we even haven't found effective technical solution to degrade it technically. This is really a real issue, and it has also severe health problems. So it is related with liver damage and fertility problems, cancer, and so on. And at the moment, the only way to get rid of these PFAS would be to ban it. We tried it with several compounds of this PFAS family, but then industry implements another one with the same or more or less the same composition, so it's really a big issue. Last but not least, pharmaceuticals. We have more than I won't don't want to lie, but several thousand pharmaceuticals on the market, and we consume a lot. I will show in a later slide also the billions which we spend for it, and these are related with a lot of environmental problems. I don't read them all, but one I would also mention is antibiotic resistances. We discharge the antibiotics in concentrations which are low enough so that the bacteria do not die, but they can create their resistances, and we the main let's say pathway for pharmaceuticals and also antibiotics is wastewater treatment plant, and the wastewater treatment plant itself is a breeding cell for these resistances, so it's also a big issue. And this is interesting to see. If you see here on the left-hand side, there's no need to read the figures, but we spent billions of euro for these pharmaceuticals, and so our health insurance is very much that high because of this high consumption of pharmaceuticals. And what on the right-hand side, this is interesting to see, there's a links to education. So we are here in the blue bubble, so the lower part, we have good education, and in tendency, or statistically proved, the well-educated people consume much less pharmaceuticals than people who don't have this education. And there's a link between water, pollution, education and health. And I cannot explain exactly what's going on there, but taking informed decision on pharmaceutical consumption is, of course, very important. And this is just one slide, what we are doing, what is my ecological niche in wastewater or in water treatment. We are dealing a lot with the dispersed point sources. So these sources which are in between diffuse agriculture and the large wastewater treatment plants, because we have thousands of these dispersed small point sources, and one is, for instance, stormwater effluents. This is the city of Rostock, 200,000 population equivalent, and we have all these black dots are stormwater effluents, yeah? And stormwater is not clean. On the middle hand side, you see our federal state, Mecklenburg-Vorpommern in north of Germany. These are all wastewater treatment plants, and it is a very rural area. And we have more than 500 wastewater treatment plants which are below the threshold where they need to remove nutrients or even a fourth treatment step for micropollutants. So how to deal with all these small wastewater treatment plants. And on the right-hand side, specific topic is the runoff from agriculture farms. This is heavily polluted. So if you measure the stormwater runoff from some farms, it is is even more polluted than raw wastewater from an urban society. No one cares for it so far, but we need treatment there. And this is also related with hygienic problems, of course. So this is what we are doing in Rostock very often, or mainly. I would like to summarize. What I've not told you is the problem of the oral fecal cycle, because we resolved that problem in Europe. Every 30 seconds, one child is dying from waterborne diseases. Every 30 seconds, but not in Europe. We have solved that problem by an effective drinking water supply and sanitation, but this needs to be maintained on that level, and this costs a lot of effort. But we have to do much more on proactive mitigation of pollution. I named nitrate, phosphorus, and micropollutants. And then in that priority, we have to think about how to implement technical barriers to ensure our water and food quality. And only in the last priority, we probably also have to think about a posteriori rehabilitation measures. Thank you.
Thank you. Thank you. Lots of interesting information, and I hope that will produce more discussion after this, because I see lots of interesting data. So after me coming to more, I will talk about more details about data management, and my great pleasure to introduce Dr. María Eugenia Gas-Lopez, coordinator of the Big Data, Artificial Intelligence and Biostatics area at La Health Research Institute in Valencia, Spain. Dr. Gas-Lopez holds a PhD in genetics from the University of Valencia and has more than 20 years of experience in molecular biology and biochemistry. She has worked as a researcher at the Barcelona Biomedical Research Park in the Príncipe Felipe Research Center, focusing on the gene expression, regulation, and renal metabolism science. 2019, she has contributed to more than 20 e-health and health data science projects, bridging the public and private sectors with translational approach. She has participated in a number of the projects and currently coordinates the Omics Space, a flagship initiative on federated health data. In addition, she has taught at master's programs in precision medicine and biomedicine. Please join in welcoming Dr. María Eugenia Gas-Lopez and talk from data to sustainable health. Please.
Thank you. I would like to start by thanking the organizers for giving me the opportunity to present the work we are doing and to be involved in this roundtable. And as we said, I would like to explain you the work that we are doing in terms of interoperability research ecosystems. Okay. I would like to start by explaining you why the some of the challenges that healthcare systems are facing currently. First of all, one of these challenges is the aging population, that this drives to a growing demand for care resources. And also we have a problem with that this leads to an increase of chronic diseases that at the end it turns that we need for long-term and coordinated care. We also have fragmented care. That means that, I don't know, probably you always have heard that maybe you go to primary care and after you go to the hospital and you complain because they are not coordinated. This means fragmented care. Also, we have limited interoperability. This has the consequence that they have data silos, and this leads to inefficiency because we are not able to connect all the information. And there is also pressure to improve outcomes while controlling costs. And in this transformation, one of the things that might help to get a more sustainable system is what is digital transformation, in which analyze the data has a real impact. That means that this challenge that I explained you before requires a shift in how we manage health systems toward a system that is more integrated, data-driven, and patient-centered model. In this slide, what I want to summarize is like what it means when we are talking about digitalization. Digitalization is something more than technology. This means that we have to put the data and patient at the center, and the digitalization process gives us the opportunity to turn data into a strategic asset. And why this is? Because if we think in patient-centered care, we don't only think about what is included in the electronic healthcare records. We need to know that we have to integrate, that there is more data that we need to manage. If we have all this process, we have to provide to physicians with tools that will allow them to have an easy access to clinical relevant information. And the system that we are providing, they need to integrate clinical knowledge and also best practices. Also, if we want to have a continuity care pathway, we need to promote multidisciplinary teams. They need to be collaborating. And as I said before, we need to integrate data from different sources. And this will allow us to take decisions based on evidence. And also to implement, it's not that we only can implement what is called 5P medicine, but also value-based healthcare. Now I would like to explain you the digital transformation process that we are doing at LaFe Health Research. It's LaFe Health Research Institute, but we are collaborating for sure with the LaFe Hospital LaFe. And I wanted to start explaining you that the community, the Valencia community region have 24 healthcare areas. One of these healthcare areas is LaFe Health Department. And here, what I indicate is the current data environment that we have. In this green part, what is represented is the corporate health system. That means that I go to the hospital and they run a lab test. It will be stored information in one of these corporate systems, okay? From this corporate system, the IT department, the hospital IT department has prepared different views, okay? This makes that this data can be accessible and we can analyze this data. The blue environment is what we call production environment and can be only accessed for primary use. That means for clinical decision. If you check the data that is stored there, you can see names, for instance, okay? The blue one has an identical copy, is the second one. And this is the test environment. It's identical, as you can see in the structure. And the idea is that before moving something to the production environment, it will be tested in the second one. But you see that there is a third one that is depicted in orange. This is what we call big data platform. And this environment is only intended for secondary use. That means for research purposes. And the difference with the others is that in this case, the data is pseudonymized. That means that if we check, we cannot see the name of the patient, okay? But here, all these things that I indicated with this, well, this or this or this, is what we call local format. That means that imagine that we write down everything in our own language that no one can understand. That means that we can have access to the data, we can analyze this data, but the conclusion that we will draw or everything that we will develop, it will work only in our environment because this is our own special language that no one can understand. But as you know, if we want to collaborate in a research project, we need to be able to exchange and collaborate and work together. And how we can resolve this? We can standardize this database that is, as I say, in a local format, and we standardize this information in one common data model. That means that imagine that we translate all the information that we have in our own special language in English. That means that will allow us to collaborate because now we can exchange the information. And because the three environment that I can show you here are identical, that means that we do something in the context of a research project. That means that we are working with the orange one. We can translate what we have done to the other environments for primary use. If I have to, well, in this case, we have access. If we are talking about the patients that we are responsible for, that is around 300,000 patients, we have information from primary to tertiary care. But the 60% of the activity of the LaFe hospital is due to the reference activity. In this case, we can only see what is happening inside the hospital. And we have to give you some numbers. I can tell you, well, this database is updated on a daily basis. And the pseudonymization process is controlled by the hospital IT department. And I can give you some numbers. Well, currently we have information for 2.8 million citizens, and you have here the numbers of the data marks and the table that we have, the columns and the rows, but the rows is increasing because every day the database is updated. That means that if something is going on, for instance, today at the hospital, they are running some lab tests, tomorrow morning this information will be in the platform. And there is also 40 million nodes, 40 million of clinical nodes. And sorry, no, it's in the other way. No.
Okay.
Oh, shit. Okay. Here. And the information that we have, if I have to summarize, currently in this orange environment, in this case the big data platform, currently we don't have access to omic data. We don't have information that is provided by the patients. That means we don't have prompts, or we don't have information that is collected using devices. And we don't have, for instance, information for the biobank. And now, this year, well, at the end of the last, in 2024 we got a funding from the Spanish ministry, and we are running one project that is called Omic Space. And this project aims to prepare and build up a federated data space for healthcare research. In this case, what we are doing is that we are incorporating more information to the one that I previously described. We are integrating genomic data and information from the biobank, and also we are preparing and connecting a federated network. That means that we already have connection with 7 other nodes that are places in different parts of Spain, and also we are connecting with one European database that was made in the context of 2 European projects that were called Harmony and Harmony Plus. That means that in order to do this, we have to speak the same language, and that means that we have to work with standards, and we have to be connected. And it's something that we are doing right now. And why we are doing all this, or what do we need if we want to do all this? In order to do this digital transformation process, what we have done is we need to have a cultural change, and we also have to change the structure of the organization. It involves or implies that we need to have more digital skills. We have to have interconnected and interoperable system, and we have to have a good data management. If we do all this, and why we are doing this is because if you are doing this digital transformation process, you can increase collaboration between structures and citizens. You can transform data in key information. For sure, you can boost translation research. You can improve decision making. We can move to what is called 5P medicine, and also value-based medicine. That means that you are not only checking outcomes, you are measuring what you are doing, and you can also do benchmarking. You can compare with other institutions. And I wanted here to summarize that all the key benefits that we are doing, for instance, for the digital transformation of one project as Omic Space, this has an impact for sure for the research and for the industry, because as I say, it's an ecosystem, an innovative ecosystem that promotes the collaboration between private and public organizations. It promotes the capacity to do translational research, also have an impact on healthcare professionals, because as I said before, the idea is that they can have access to more information, more connected information, and they can have tools that they allow them to take decisions, and we can give tools for them to make decisions that are more evidence-based, but also have an impact in patients and society. And for the last, I wanted to explain and to say the idea that what we are doing at La Fe Health Research Department is we are putting patient and data in the center. We know that we have to interconnect with other institutions and also interconnect data if we want to move forward, and that all this has done, you need to integrate data from different sources, and this must have always an impact. Or everything you have done, you have always to keep in mind that the idea at the end of the day is that you have to, what you are doing has to have an impact on patients and citizens and society. And that's all.
Thank you. Very interesting to understand digital transformation, digitalization, differences between these two, and the benefits of the good data. Thank you, and we are coming to the fifth presentation. It's my pleasure also to introduce Dr. Sophie Mavrikou, Assistant Professor at the Laboratory of Cell Technology at the Department of Biotechnology, School of Applied Biology and Biotechnology, Agricultural University of Athens, Greece. Dr. Mavrikou holds a PhD in the development of bioelectric biosensors and vitro toxicology, MSc in natural products and enzyme technology, and BSc in biotechnology, all from Agricultural University of Athens. Her research focuses on the development of biosensors, in vitro toxicology, cell and tissue culture, and biochemistry. She has participated in numerous national, international research projects and has authored and co-authored several scientific papers, book chapters, and conference publications. He's also the editor of an international book, holder of national patent, and co-founder of the AUA spin at University of Athens spin-off company, pioneer of diagnostic technology, and she's a recipient of the Idea Incubator Competition Prize and the Innovation Award from the Greek Ministry of Defense. So please join me to welcoming Dr. Sophie Mavrikou in her presentation.
Thank you very much for inviting me to be here today. As already said, I'm an assistant professor at the Department of Biotechnology at the Agricultural University of Athens, and my expertise is in the development of biosensors for several applications. So my today's presentation is going to be a little bit broad, covering the part of early warning and the detection of diseases, and specifically zoonotic diseases. So we already have the previous paradigms from the pandemic of COVID-19, and also from diseases such as SARS, MERS, Ebola in Africa. And all these lessons have taught us that we have to be prepared for diseases that are going to occur from animals, zoonotic diseases. So, zoonotic diseases basically make up about 3/4, as you can see in the slide, of the infectious diseases, posing global health, economic and environmental challenges. So the outbreaks of COVID-19 and Ebola have cost billions in losses of deaths, human lives, livestock, and basically many economical losses, and increase the link between the infections from animals to humans. All these diseases lead to ecosystem disruption, and basically they occur from the effects of climate change that we already have noticed all these years. So what we need is to have an One Health approach in order to be prepared for the cases of emerging new diseases that are going to arise through the climate change effects. And basically we need early detection systems and robust surveillance systems to prevent future epidemics and pandemics. Modern technologies are basically helping us to have disease surveillance from slow manual to real-time and predictive platforms. So instead of mainly relying on laboratory reports, we now integrate data from the public health, from the environment, from animals, and from digital sources. So we have, as you can see, 6 main technologies. We have big data analytics, artificial intelligence and machine learning, the IoT, Internet of Things, geographical information systems and spatial analysis, remote sensing, and diagnostic technologies, molecular technologies, and point-of-care technologies. Each of them plays a specific role, from collecting data to analyzing patterns to predicting outbreaks before they spread, and together they form an integrated system capable of turning complex data into actionable insights. So I'm going to start from big data. Even the previous speaker have covered a lot of what I wanted to say regarding this part. We already know that big data can process vast, diverse data sets, including health records, lab results, even social media. And IoT, the other technology, is ordered to identify any early warning signs. For example, in China, we have the integrated health big data platform that was able to detect additional dengue and tuberculosis cases that were missed by manual screening. On the other hand, we have the multi-omic approaches that are combining genomics, proteomics, and metabolomic data in order to trace transmission and identify several vaccine targets. Artificial intelligence builds on this by recognizing patterns and forecasting outbreaks. An example is the Blue Dot application that you can see at the slide. The Blue Dot AI is supposed to be the application that was able to flag COVID-19 outbreak by scanning global news and articles days before the official alerts occur. So, additionally, we have machine learning that are models that have also predicted some examples of dengue fever outbreaks by analyzing weather and vector data. We have some online signals like spikes in search terms for avian influenza that have been preceded lab-confirmed outbreaks, and together these tools move us from reactive response to proactive prediction, though we have some issues like data quality, privacy, and bias that still need attention. On the other hand, we have the IoT technology, the Internet of Things, that connects several networks of different sensors and devices that can continuously monitor humans, animals, and environmental parameters. We have some wearable sensors that can track livestock health. This could alert authorities when abnormalities appear, and in this way we could prevent a wider spread. During, as an example, during an Ebola outbreak, IoT devices helped remotely monitor patients' vital signs, protecting healthcare in healthcare workers. The geographic information systems add the spatial layer by mapping hotspots, by tracking disease movement, and identifying high-risk zones. An example for GIS mapping was a case in Iran in 2014 that could monitor the hotspots for leishmaniasis and brucellosis and helped authorities target not only vector control but also vaccination programs. And by combining IoT's real-time monitor with GIS spatial analysis, we could visualize and respond to disease threat more efficiently. We have also remote sensing and satellite imagery that takes surveillance even further by basically observing environmental changes that can influence disease spread. Using drones or even satellites, we could track parameters such as the rainfall, the vegetation, the temperature. All these are factors that affect vector populations. So, a case in Italy, some researchers combined satellite imaging with deep learning in also to predict West Nile virus activity that was based on soil moisture and temperature data. And on the other hand, as you can see, we have the well-known model of NASA, the USDA's Rift Valley Fever Early Warning System, which is able to monitor vegetation and sea surface temperature data to predict some outbreaks months before in advance. So all these tools allow governments to act preventively, for example, by vaccinating livestock or launching mosquito control before outbreaks occur. And we also have the diagnostic technologies, molecular and point-of-care technologies. At the laboratory field, we have molecular technologies for precision detection of several pathogens. We have the gold standard, the PCR technique that identifies infectious agents very quickly and helps with the help of next-generation sequencing that allows complete genome analysis and is essential during COVID-19 to track several variants and transmission routes. A relatively new technique is the LAMP technique, a very rapid and portable method, ideal for field use in resource-limited areas. Meanwhile, we have, as a previous speaker said before, the environmental and wastewater surveillance that detects hidden circulation of pathogens like, let's say, Leptospira or other enteric viruses, providing early warning of community transmission. And finally, we have portable techniques such as biosensors and connected point-of-care devices that enable us now for real-time pathogen detection, even outside the laboratory. These tools can bring diagnostic technologies closer to the source, reducing any delays that occur from extensive sample pretreatment or laboratory techniques and improving the response speed. So we have, beyond surveillance, these technologies can also improve the response during all these outbreaks, the zoonotic diseases outbreaks. Early warning systems analyze data continuously in order to flag the abnormal signals. For example, let's say we have some systems that can detect changes in the poultry vocalization and can identify the avian influenza days before the pandemic in the flood. Information sharing platforms link public health, veterinary, and community data to promote rapid coordination. Basically, during the COVID-19 pandemic, the CDC's digital communication platforms helped countering misinformation and guide public behavior. And point-of-care diagnostics, such as the Abbott's ID Now test, provided results in less than 5 minutes time, enabling quick isolation and treatment. Telemedicine is another opportunity for remote diagnosis and treatment, especially for patients in quarantine or remote regions. There are some apps like the Trace Together system and Radar COVID that have been used and doubled the number of the detecting contracts compared to manual tracing. And together, all these innovations shorten the time between detection, communication, and intervention, a very critical factor for saving lives. So, despite these advances, there are several challenges, implementation challenges, we could say, that remain in order to have some effective early detection systems. We have many low-income regions that still lack the infrastructure and connectivity needed for real-time surveillance. We have the problem for data privacy, interoperability, and political barriers that continue to limit information sharing. And you know that predicting zoonosis, those that are not yet identified, requires integrated systems that are capable of detecting anomalies across all these pillars, across human, animal, and environmental data. So achieving a truly global system will demand stronger One Health collaboration stronger policy alignment and sustained investment. To move forward, we must expand digital infrastructure, of course, train the personnel, improve data governance, and build public-private partnerships to mobilize expertise and funding. So, in conclusion, integrating technologies such as artificial intelligence, IoT, and diagnostics allow us to build faster, smarter, and more connected surveillance systems. By doing so, we can move from reacting to outbreaks to predicting and preventing all this days before they occur. So, thank you for your attention.
Thank you, Sophie. Thank you to all presenters. It was very interesting listening to your opinions about health prevention and health management. And I hope there is a lot of questions now, and they are very happy to answer to all your questions. So see the smiles on their faces, like waiting for your questions. So I'm just opening here for questions. I hope there is a question. There is a very interesting for the future. So okay, if you don't have a question, I will start. Oh, thank you.
So I would like to ask a question for María Eugenia related to the database and all. Are risk factors being considered, like for example, I know that for hair stroke, which is kind of a rising concern sometimes in healthcare because it has a lot of like, well, lots of cases have been reported, of course, like it's a common disease, let's say, or a common happening in society. Some risk factors are like sometimes like something to be expected, like for example, people have some weight issues or people having like some lifestyle, more like lifestyle related, but also being able to be recorded in like the medical records, sorry, like also smoking. But also I once saw an article that saw that there was a statistically significant difference between, for example, the fields of work. People who were working in more like a stressful fields of work were undergoing or were under bigger risk of suffering of hair strokes, and I think that's also can happen with other kinds of diseases that are kind of common inside society. So my question basically is, what kind of like factors of risk are being considered in the database, if any, and also if you think that implementing this database and trying to go for a more personalized healthcare for people would also mean that we have to maybe rethink how primary care is given and what questions are being asked to the patient in first instance.
Okay, related to the, if I understood you, the first question, I guess that you are asking me if during our research we have identified some.
Do you consider like any kind of risk factors, for example? So because I think it's not like it was like global, right? Like they're considering lots of factors and lots of like potential diseases. So for instance, like how do you think like risk factors and what are you considering now?
But wait, I have to tell you, because I guess that if you ask me about specific diseases, I will tell you the risk factor that is not, because when you read and already when you speak a doctor, they will tell you. Yeah. But I guess that you are asking me if we're using and analyzing the electronic healthcare records, the real world data that we have. Yeah. I have to be honest, because when we are running some different projects, all the questions they are doing, and it's related, how we say, depending on the work, the people, is we don't have in general. I'm talking about globally, in the population level, we don't have all this information of lifestyle. Then we have this limitation. When we are doing different projects, in general, what's happened, for instance, we were running a project that was focused on lung cancer. Then the physician asked if we could identify or measure different KPIs. And what's happened sometimes in general, all these questions that you are raising, they have a lot of relevance. But when we start to analyze the data that we have collected in a retrospective way, we cannot give a really good answer, a good analysis. And what we are doing in all these projects in general will always happen, independently of the disease that we are dealing with. At the end, what they identify, they realize that they need to have all this information, and they arrive to a compromise. That means that we have, because we always work, for instance, in the lung cancer project with multidisciplinary team, and we sit on the same table, all the professionals that are involved since the first moment that the patients have contact with the healthcare system, and they say, okay, we realize that we are missing this information that it was really important. They identify, imagine 50 the variables that are relevant, but they know that we're starting to implement improvement of the medical record, the registry, because we only will have a really good databases for secondary use if we have a really good databases for primary use. Yeah. And what's happening is that they arrive at compromise. They decide, okay, we have to be realistic. We cannot improve, and started to collating, the 100 variables that we want, but we're starting compromising, collating this one, and maybe it's only 10. And for instance, in lung cancer is what we are doing, because they are also. In lung cancer, it's true that we can have the smoking habits, okay, but it's not always completely and well record in the electronic healthcare record, because all this information in general is registered in clinical notes. And the way that they collect is different between professional and the other. And for instance, in this case, they decide, okay, we know that this is relevant, the habit, or the other, if the alcoholic habit, and they have arrived to the compromise that from this day, we are going to collect this variable systematically in this way, and then it will be easier for us, and we can run all this. And sorry, I forgot the second question that you asked.
It was more related to because now it also has to do with this fragmented healthcare system that we have sometimes, because something I find kind of curious is that, for example, in my line of work, well, because I'm working as a researcher in this university, so we have to undergo, for example, under a mandatory healthcare check. But it's curious because then I think those reports, can they be accessed, for example, by the hospital, by the another healthcare systems, or is just limited for the company that's dealing with this kind of check?
You're talking about the access that we have for
for example, because if there are records of people, because in this case, for example, you ask if you smoke, or for example, alcohol consumption habits or things like that. Can those records, for example, be accessed by the hospital to for example, work on your research, or considering all these risk factors, or since it's another institution, it's just separated?
In our case, because all the information is in the same institution, we can have access. When we have to give access to, well, it's not easy that we grant access to another institution, okay? We have to go for a process because there is a data governance model. But if it's inside, we can have access, but it's to always have a procedure. It's not that I want to have access to the data because I'm running a research question. You have a procedure, you have to demonstrate, you have to justify, and there's a procedure, and you fulfill everything that is required, you can have access. But always there are different, at least in Spain, that you know that you have different legal basis to have access, and you have to fit in one of the, in your case, it's I don't know how to say in English, but I don't know how to translate the law in English, sorry, but disposición adicional 17ª, if someone can translate this, but in this case is how we can have access to this information, okay? So.
Thank you.
Thank you.
Thank you. More questions? I know.
Yeah, thank you. Thank you very much for all your presentations. It was really interesting to hear it. I have actually a question for Professor Birute from the Klaipeda University related to children injuries. What are the main causes of those injuries in your country and maybe in some other European countries? What are experiences? And why I'm asking, because in Croatia, where I come from recently, we have a huge increase in child or children injuries related to the scooters, particularly these electric ones. I think in Croatia last year only it was more than 200% the increase of injuries among children related to this problem. So I consider it a problem. So what are the experiences in other countries? As a surgeon, I see you're a surgeon, so do you have similar problems and how to deal with this?
Thank you for your question. Yes, if we talk about Lithuania, so half of injuries, mortal, fatal injuries in children are road traffic injuries. They're most serious, with most bad consequences, with disabilities and long-term consequences. As well, generally in child injuries, in Europe we know about 5 main causes of injuries, so it's road traffic injury, burns, drownings, falls, poisonings. And regarding road traffic safety, yes, scooters recently are a big problem in many countries. There was very popular new mean of transportation for kids and for adolescents and for young people. But some countries now already started to give restrictions for using scooters because we are not prepared for them really, and we don't have enough measures for scooters. We have very terrible tragedies in Lithuania when children died in accidents when they were riding scooters. One child, for example, died when parents have seen this situation, and after that traffic police used more measures like controlling on the streets if child is riding with helmet, if he has vest, if he stops beside traffic lights, and if he goes by foot through traffic light, not driving scooter. And generally now we need to think about more active measures what we could use for these scooters. So maybe that, thank you.
Thank you. More questions?
I have a question.
Okay. Please.
Yeah, I have a question to Sophie Mavrikou concerning the sampling. I understood very well that you monitor the drivers, but how about the sampling to get the real information if there is a pathogen, yes or no? What do you sample? Do you sample water? Do you sample insects or whatever?
It depends. It depends. Regarding the
Yeah.
application,
Yeah.
we have developed sensors for blood plasma, for rhinopharyngeal swabs during the COVID period. We also developed sensors for water monitoring, so we could have water as a sample. And of course for food safety applications, because the diseases could also be spread through the food chain. So it depends regarding the sample.
So as water engineer, I was thinking about if there exists already, let's say, online sensors in water which work completely automatically, or is it always, let's say, handwork? And then if it is always handwork, how comes this Internet of Things into play? Because if you do handwork, then you can also put it in as number.
Well, there is a trend that we need water monitoring without any external interventions during the sampling, but to my knowledge, I don't think that there is something an already available solution for this yet. But
Okay, thank you.
Thank you. More questions from the audience? No? I have the question for the Ingrid. When we discussing before this one, and to what extent can the principles of the Blue Health and One Health be integrated, let's say, in a national and EU public health frameworks to promote long-term ecological and human well-being? Something like that. What is your opinion? What is the future of this?
Just say that it's already done, because One Health, for example, is a concept already established in Europe, EU policy. So we can revendicate it, and we can apply more and more research in that concept. Concerning Blue Health, you have also an European initiative which is named Blue, Green and Biodiversity 2030. And in this European initiative, you can also, they encourage initiative about the restoration of ecosystem and the sustainable health. So it's already done for Europe.
Great. Great. One step away. Any more questions from the public? If no, then for Jens, I have the question of talking about these different topics. And what is your opinion, let's say, how does agricultural activity contribute to this declining water quality, and what sustainable solutions could mitigate this? Okay, maybe we have the solution, but maybe opinion and...
Yeah, I think that, let's say, different levels. I'm not the expert in agriculture, but we need to reduce the pollution in this excessive use of fertilizer. I don't know how to really achieve this. And so in drinking water protection zones, this is done by compensating agriculture for less using those fertilizers and compensating the difference in harvest and those things. This could be one option, but yeah, I have not a ready solution for this. I'm more on the field of this wastewater treatment, so there I feel more safe. And meanwhile, we have the new wastewater treatment directive, which came into play with the beginning of 25, and they demand already a fourth treatment step for these micropollutants, but this is related only to the large wastewater treatment plants, 150,000 plus. Then there needs to be performed a risk assessment between 10,000 and 150,000, and then to perform some prioritization. And we are actually dealing with this, developing those risk assessment tools. But what about all the very small wastewater treatment plants which are discharging in also often small receivers? And there we also have this link to the hygienic problem. So there I think we have a need of doing more. And if you look globally, of course, we have to improve sanitation. This is, yeah. And the last is probably the recovery issue. So we see in several European countries that they implemented some ordinances or laws to foster phosphorus recovery, but if you see this, this is also interesting. We can of course recover actually most of the phosphorus from wastewater treatment plants if we want to. But if we see that only from the mined phosphorus, only 10% end up in our nutrition, and the rest is diffusing somewhere, we also have to think about much more of reducing the losses on the way onto our table.
Okay,
yeah.
Thank you. We have one more question now. Okay, I have one more general question. We just reach interdisciplinarity now, talking about this is interdisciplinary approach and something like that. And who wants to answer? There is no specific question to someone. How to interdisciplinary collaboration among medicine, environmental science and technology could strengthen the sustainable health outcomes in general? Maybe some opinion. Maybe the audience can help us in this one discussion. There is a lot of topics here discussed going to interdisciplinary approach, and there is a lot of approach for the future, and this one of the challenges for EU-CONEXUS research area, the sustainable health and disease management, and we're talking about the number of European project goals in this field. So maybe just to connect this interdisciplinarity, technological approach and sustainable, Ingrid mentioned talking about different disciplines, introducing social science and humanities in this research. But in general, what do you think about, opinion about this from your point of view, from your discipline, from your perspective.
Probably I could start. I think so. These blue-green infrastructures is of course a nice example of having all these synergies. So from a water engineer perspective, if we implement more blue-green infrastructure, we reduce significantly the stormwater discharges. At the same time, we improve the quality of at the city, and this probably helps to improve human life, and probably also helps to bring kids out again, and can also even help to prevent injuries. So I think this is a very nice example where we can see a lot of synergies, and probably so far it's not quantifiable, but so just from the causal thinking, I would say this is one of these examples. Yeah.
Thank you.
I totally agree. I believe that the quality of the media and water is a starting point. Is a starting point of the sustainable health, because it's the vector of several pollutants and so on. So we have to preserve media effectively and work on water and quality on water.
Okay, Birute.
Yeah, I think collaboration among sectors is very important, and we need to have appropriate databases where we can work with data analysts, and to create safe environment. There is environmental health specialist comes into the floor, and so strong collaboration can provide us to sustainable health promotion.
Thank you.
For instance, in our case, what I can say is, for instance, in the funding program that is funding Omnic Space is not only for health. All of us, we are building different data spaces from different sectors, and now, for instance, the Spanish ministry, all of us, we are learning to build in all these spaces and skilling everything, but it's trying to foster the collaboration between the different spaces, as we are saying, like, in order to be able to connect, to collaborate, to know what other spaces they are doing that are not related to the health, but in order to try to find synergies, and also we have to, at least promoting the networking, and we have to explain each other our barriers, our challenges, and to find a way that all these spaces that can collaborate, for instance.
Thank you.
And basically, the digital connection of all the techniques that we said, all the technologies that monitor the disease spread should be safely locked, because there are many issues that occur from the digital technologies.
Thank you.
Don't forget the social scientists.
Yeah, of course. Without social sciences, we could not do anything. We talk about lots of these previous 2 days about inclusion of the social science and humanities in most of these researchers. So interdisciplinarity with the social science and the humanities is impossible. So we rely on that. So if no more questions from the audience, I would like to thank you once again. I think it's very fruitful discussion, very fruitful presentations, and I ask you, the audience, do not feel fear to approach, to ask questions. There is a lot of space for discussion during the break now, during the whole day, and not just for this panel, but for all panels. If you have any questions, we are all here. Please feel free to approach, to ask, and we'll be happy to discuss with you and to receive your information. And finally, I would just like ask Marta. Marta has some information for all of you, just about this one. So Marta, please.
Okay, good morning, everyone, and welcome to this third panel of the EU-CONEXUS International Congress. We are going to debate about adaptive and resilient urban systems, smart infrastructure, and the coastal cities of the future. My name is José Luis Muñoz, and I'm Senior Advisor for Innovation and Transformation, and I have the honor to moderate this debate with all these speakers. And we are going to talk this morning about coastal cities and how should be rethinking all these urban systems in order to transform how we live, how we move, how we build, and how we share the space in all these areas. We have a very high-level panel of speakers here across Europe, from Lithuania, from Croatia, Romania, and also from Cyprus. And we have different point of view, but our challenge will be that these will be deep connections between the different point of view across Europe, but also across different challenges that all this team is working. They are working on reducing urban energy demand and integrated renewable energies on the cities. They are working also on transforming ports, cities through infrastructure, and how this could affect the way of living of the people that are around these infrastructures, this area. Also, they are working on building urban resilience through local climate planning and how this can help for this transformation. And then also something very important, how we are going to safeguarding access to housing and land for the people, for the local people that are living in these areas. That's why I encourage all of us not to focus only on solutions. It will be good to focus especially on relations between infrastructure and people, between policies and place, and also between past and future. That's why this is what we are going to debate here. Before beginning the discussion, I would like that each of the panelists, they are going to make a short introduction, what are their perspective of this topic. You know, that's why then later we will start the debate, and at the end we will have the opportunity, if you wanted to make a questions from the audience, it will be really very welcome. Then let's go to start, okay? And let me to introduce Cristiana Croitoru. She is Associate Professor at Technical University, Civil Engineer in Bucharest, and Director of the Doctoral School. She is working on sustainable buildings, cities, energy efficiency, and digital twins. Also, she has involved in several Horizon Europe projects with a strong background in sustainable and building system energies, but also she works at the intersection of technology, building design, policies, and how to help cities on this transition toward more resilient and inclusive urban futures. Cristiana, the floor is yours.
Thank you. Nice to see you, dear audience. I'm very glad to be here, to have this discussion, which is a little bit more philosophical from my perspective, since we talk a lot about resilience and sustainability, a topic which cannot detach technology from other parts of our society. And one of my first loves, let's say, it was the beginning, how to create better buildings and how to let's say, optimize this relationship between the occupant and the buildings. We have, in our team, we have different approaches related to energy efficiency, sustainability of materials. And lately we have a little bit oriented over the digitalization and technology inside the buildings, because we saw that we cannot create buildings that are inert anymore. They need to be adapted also for the users, but also for the larger scale, which is the city. So it's an ongoing perspective between and relationship between citizen, building, and city. So that's why we need to look at this built environment that we are creating and we are designing. What does it mean for each of the scales? If we look at the human scale, at the occupant scale, we are more focused on health and how we perceive the indoor environmental quality. But we also need a reaction from the building to react at our own needs. So that's why the building itself needs to be responsive to those needs, needs to be designed in a way that creates the perfect environment for those needs. So that's why this building needs to read their occupancy, really needs to adapt its own usage to the occupants. And then later needs to optimize its own consumption. Why? Because if we look at the larger scale, to the city scale, where we need to have another perspective, those buildings need to be integrated in the city infrastructures, and we need to be part of electrical grids, of thermal grids. We need to see those buildings like points of interest in those cities, and to create an overall better built environment. So that's why today we will focus a little bit more on this city scale and how those points of interest, which are the buildings, can better adapt and can create a resilient built environment. If we look at those cities, we see different flows. Flow of energy, from my perspective, this is what I see first, but also flow of traffic, flow of water, flow of different things that create a living organism in the end. This city could be, let's say, seen as a living organism. Of course, we know those cities have a lot of energy consumption, and we are now in a situation where we need to reduce. We need to align to decarbonization targets of 2050, when we need to have neutral cities. How do we get that? One of the answers is to start reducing the energy demand at the building level, because buildings are associated with a lot of carbon emissions and also a huge part of energy consumption. Cities themselves account of, I don't know, maybe 70% of the total energy use, but buildings have a large share on that. So we need to make the buildings require less energy, require to be flexible, to optimize the envelopes. What does it mean? All these buildings need to reduce first the essential part and the essential step to reduce the energy. We need to consume less as possible, because of course we depend on this energy and we cannot live without it. Decarbonization doesn't mean zero energy. But we talk about a lot of optimization and energy flexibility. This is an essential step on this reduction of energy consumption. We need to create better building envelopes. We need to invent and this is where technology comes, to invent better building systems with better efficiency, so that we can reduce the primary energy in the end. But after that, when we talk about these buildings, they also need to be responsive. They need to further adapt, and we talk maybe about unusual concept, or we started to talk about them, like digital twins. What are those digital twins? Why do we create them? Just to create data? No, we create them to better understand and then to further optimize the consumption and the use of the buildings in order to have a predictive way of understanding this energy consumption. So,
2 minutes.
Oh, sorry. Okay. And then when we first reduce the energy consumption, we need to see, okay, what about the rest? Where is the source of the energy where we can require an extra consumption? So at the building scale, we have different technical systems. We might all know about it. Energy systems, but also storage system, which is also very important. While at district scale, we need to start thinking about this sharing energy and to consider the buildings like energy assets, which can be contacted and contracted whenever we need. And while at the city scale, we have let's say the overview, the umbrella overview, where we can see what is the energy potential to better do the analysis, to overlap with different other social layers and some other economical layers, for example, in the cities, to better understand where are those, where is this energy potential that we can further use. So that's why we end up in the third place, where, not the last place, but one of the three main important steps, where we need first also to focus on this fairness of energy. What does it mean to use energy? Does everybody afford energy? So we should not consider this decarbonization with any cost. This decarbonization measure needs to be something that is adaptable to their own citizens, and we should look at the vulnerability of our own citizens, and we should think more about, for example, energy poverty, which is also a very important topic. And this climate neutrality should be a responsible way of us, researchers, to respond to these challenges, but leaving no citizen behind. Thank you.
Thank you very much, Cristiana. Thank you. Let me introduce Vilma Navikiene. She began her professional journey in Vilnius, the capital of Lithuania, at the Sustainable Mobility Agency. She was working a lot on that for making urban transport cleaner, easier, and better connected. Today, she is now working in a very challenging initiative. This is in the Port Authority of Klaipeda, also on the Green Port Vision, that includes not just marine transport, but also social, economic, environmental, and institutional goals. That's why, Vilma, the floor is yours.
Thank you. Hello, everyone. It's truly my honor to be here among so many professionals and professors. I'm from the business part, let's say, Authority of Klaipeda Port. I'm replacing my COO here, Algis Latakas, you might know. He's a part of this community. So, and actually the Port of Valencia is our inspiration, let's say. And I want to present what we are planning to do in the green vision of our port, but because Port of Valencia is an example of how sustainable innovations can go hand to hand with the technologies and with the business as well. So let me briefly introduce Klaipeda's Green Port Vision. It's our roadmap towards a climate neutral and future ready seaport. So it's gonna cost a lot for us. We plan it to be like 600 million euros. But we see Klaipeda port as resilient adaptation, not only responding for climate changes, but as a driver of innovation. And we try to lead this narrative in the communities, in the mayor office, I would say, in the local politics, and in the country. And our Green Port vision connects many sustainability goals, I would say. Smart technologies, cleaner technologies, smart infrastructure, and as well community well-being. And a good example of it is onshore power supply. We are now on the way to build it. And our first stage starts with the 4 stations. And it comes and goes across key terminals, fleet base and cruise terminal. And this project shows that you can reach your goals step by step with single infrastructure change. And that's all the visions comes from ideas, and then by doing and implementing things, you can reach all the goals, and efficiency, urban life, healthier, and etc. Our second project, which is starting in 2026 in Klaipeda, is green hydrogen production and storage facility. And we are very happy and very proud of being this project implemented, actually. It will keep supply of hydrogen for port operations, and as well, as far as I know, Vilnius, when I worked for mobility in our capital, we bought buses that was running by green hydrogen. Maybe Klaipeda will turn into that way. Now we have electric public buses for people, but this station, green hydrogen production and storage facility, is a good step forward, I would say, to build your own ecosystem and be that we will see foundation for a resilient regional energy. So I want to present the third example. You know that in families we tell kids what we have to do. At university, teachers us tell what we have to do. But reality is that you have to lead by example. And the authority of Klaipeda port actually is leading by example from ourselves. We are modernizing our own fleets. So now it's under building our new hybrid vessels and hydrogen-powered waste collection ship. It cost huge money. Does it worth a business case? Not at all. But it's a practical example how green technologies can reinforce resilience, and we have and we take the step to lead this narrative and this discussion about our ecosystem, about coastal cities transformation as well. And the last our step, our new cruise terminal, we plan that because port is very close in the city, and we want to show that port is not only for urban spaces, not only used for cargos, for business, and etc. So our vision represents the human side of cruise terminal. New philosophy, I would say, to introduce public spaces, bicycle roads, pedestrian areas, and to open port to public, where all we can share urban spaces between port and all the community. So concluding what I have introduced you, so we want to become a port more decarbonized and to be the leader of the discussions in the local communities and in our country as well too. Thank you.
Thank you very much, Vilma. Thank you. This is very interesting, you know, and this is a big challenge in Klaipeda port. Also, when you see how is the port and the city, there is all the same, you know, it's together. That's why this is a big challenge on that. And also I think this, then later maybe on the debate we can talk about that, but it's very important how to deal with all that transition and at the same time to be competitive in Europe. You know, like the Draghi report, it has been a very clear message that has been created, the EU competitive compass from the European Union, and different strategies, some of them from ports and also the maritime sector. How we can continue to be competitive with all this adaptation, and we should be done really on the right way. This involves the city, this involves the citizens, and social aspects, and that then later we'll speak. Thank you very much, Vilma. And now I would like to introduce Professor Byron Ioannou. He is the head of the Department of Architecture and lead the urban planning unit of the FredU University in Cyprus. Also, he has been working in urban issues such as climate neutral planning, housing, sustainable mobility, density and sprawl, public space, urban green spaces, planning law, and development of inclusive settlements. You can see that he's an expert on how planning the cities should be in the future. Also, he has contributed as board member in many national, European, and international built environment and urban design bodies. Thank you. The floor is yours. Byron.
Thank you, José Luis. I'm very glad being here and having this interesting conversation with my colleagues and you. And I was also enjoyed the meetings we done with José Luis in order to start preparing this panel. It was very creative, and I hope you enjoy the panel today here. Though I'm dealing with all these things that José Luis mentioned, I am jealous of the effectiveness that port cities manage their strategies and achieve their goals. And I'm afraid that it is not so easy. It is not the case for the built environment in the city, where there is no one that has the full control of the of the space. So building climate resilient coastal cities is a very challenging issue. And now we are working with Limassol City in order to try and implement projects and increase the carbon neutrality of the city. And I hope that in 2 or 3 years I will have more experiences to share with you. But I would like to start with these two. Usually I do this, I try to compare images, and José Luis was commenting that maybe we should add some more words for the audience, but I see that maybe it's better to start with the images, because when we walk around, we see images and colors and trees and buildings, and we don't see numbers and KPIs. So we have two different outlines of a neighborhood. The old one is a typical European setting, and the other is a suburban, which is in Cyprus. And always I discuss and I ask, where is climate resilience? Where is carbon neutrality here? Where is energy consumption? Where is mobility? I am sure that all of you can read these aspects, and all of you can vote which is the most resilient case and the resilient and the less sustainable case. So when you set the layout of the city and the regulation, the building regulation down, then the boundaries and the limits of improving things with tools, with very fancy methodologies are limited. Once on the ground we have a wrong settlement, then it's very hard to improve things and change things. And sometimes we say that we improve things because we compare with our old position and not with something much better. So what we see here is a lot of land take for streets, less green. We don't see at the left-hand side a smart or a rational arrangement of green spaces. We see low densities. We see land vacancy. We see soil sealing. We see a lot of things that we can afterwards measure and put in the models and, of course, make the right suggestions. But how can we fix these things? It's a huge challenge. And if we can, in which extent can we fix a city that is wrongly designed or wrongly developed? We need strategies. We need to strategically plan and act. We need time frames. We need to take in mind the coastal parameter of the cities, because coastal cities are different with inland cities. We have things that are relevant to the environment, to the land values, to the land uses, so these are taken in mind. And we can ask how, we can also ask if we can. And it's good sometimes to understand our limitations and to understand where can we, what can we achieve in the end. I have been working for many years analyzing climate local plans. Climate local plans were seen as a mean for achieving climate neutrality and addressing the cities, especially on two basic pillars: the densities, planning the proper densities in the proper places, and sustainable mobility. I think that these two are some very crucial hotspots in sustainable city development, and I think that very successfully our colleague Henry Jensen from Rostock yesterday analyzed these issues in depth. We have been working since 2019. We have analyzed, we are a huge group. You can visit our website, the EuroLCP initiative. It started as a volunteering group from experts all over Europe. We have analyzing at the first step, we have analyzed the climate mitigation plans, which were addressed by the Covenant of Mayors in 10 or 15 years ago. And now we are looking at the climate adaptation plans, which is the next step, not only to reduce emissions, but also to adapt to climate crisis and all this kind of stuff. And I will conclude this short introduction with the prerequisites we have detected in order to have, in reality, an effective climate planning. Because sometimes we produce plans, we produce strategies, and in the end we didn't get the result we want to. So what we have seen is more or less things that Cristiana mentioned at the beginning, and it's, as Julio says, as José Luis says, it's a common sense in most of the cases. It's just common sense. We need a robust fact base in order to know which is the risk, the vulnerability, the hazards, the social groups affected. We need to have clear goals, measurable goals, and also an monitoring in a second step. We need to have very clear measures and policies, diverse policies, not focusing only in one aspect, and sometimes neglecting especially the social aspect of sustainable development. We need to have politicians that are fighting for implementation, and a weakness is usually the local politicians, that sometimes they are not very keen in promoting the proposals of the expert. Continuous monitoring and evaluation, and participation in every in every step of this procedure for climate planning, and of course consistency and coherence between different components of each part. Thank you, and
thank you very much, Byron. Thank you. Let me introduce Anica Cuka. Is professor in the Department of Geography at the University of Zadar and serves as chair of the International Geographical Union's Commission on Ireland and other coastal areas. Her research focused primarily on islands, with a particular emphasis on their social and economic development. She will be really very interesting their ideas and the work that has been working especially on housing and the social aspects of that. Thank you. The floor is yours.
Thank
Anica.
you very much for the introduction, and I'm really pleased to be here today. I will talk actually about something else. You were talking a lot about engineering, ports, and so on, but I will talk about the society. Within the last few days, we have different workshops, and we were talking a lot about sustainability and about the goals of the EU-CONEXUS, that we want to create smart, resilient, technologically adapted, advanced cities. But my question today that I would like to talk about more is, who are we creating those cities for? You will see why. So, when we talk about sustainable development, I will not go to definitions because you are all aware of that. But one of the very, very important aspects of sustainable development is access, actually, to housing and access to land. So this is why I ask you the question, who are we creating those cities for? Access to housing and land is not among the 17 main goals, not in the title of the goals. However, of course, it's listed among the targets, especially in number 1 sustainable goal, and number 2, and number 11. 11 is the one dealing with sustainable urban areas, and it talks about access to housing. And when we talk about poverty, poverty and the health issues, we cannot talk about those topics without having the guarantee that our society is going to have the access to the housing. So it's one of their main rights. I'm sure most of you or all of you are from academic community, so you can read graphs very well. This is the graph that shows data from Eurostat, European Statistics Agency, and it shows how much the prices of housing changed in this last 15 years in EU. So what shocked me personally, and will maybe shock you as well, on the level of EU, the housing prices of the properties, if you want to buy the property, the prices rise for 60%. On some countries, especially here are the colleagues from Lithuania, it was almost 200% rise of houses prices in just 15 years. So I can ask you a question: is your income also that high, or did it increase that high, 200%? It's not just about buying the property, it's also about renting the property. Rentals are also in increase, almost 30% on the level of the EU. Of course, in each country, it's a bit different situation. And what is happening in urban coastal areas particularly, they are affected with tourism. So one of the reasons why those prices are in rise is, of course, inflation. It's very difficult to influence on that. But the other thing is also touristification and gentrification. And here's the problem for our members of our society, particularly the ones who are not part of this tourist development and who cannot afford to live in those cities anymore. Seasonal occupancy creates also ghost towns outside the tourist season, so those are some other problems that are coming from this issue. So how this all affects society? As you can see on the photos, I wanted to be a bit brutal. We have more and more people who are poor. Sometimes we don't think about them enough, I think. And one of the reasons why they are living like that is also because they cannot afford to live in the houses or apartments anymore. We don't have problem only with people who belong to low class, who don't have enough income. Today, the problem is also with the people who can afford, who could have afford until recently to live in their own houses or to rent houses, I don't know, professors in the school, even our young assistants at the universities. It's difficult to be assistant today in Croatia, especially in coastal town like Zadar, because your income, if you are not living in that town, and if you don't have your own property, it's very difficult to rent it, because the rental prices are very, very high, and they will eat your salary practically. So this is the problem that some scientists were addressing in their research, but I think that it's our task to talk about this more. What is also one of the side effects, I had to show this because this is the best place in Europe to show this. Why? Because Spain is the country that had maybe the biggest issues with tourism. They say tourism is a disease, tourists go home. You know that there is tourists go home like movement, and it started to spread around Europe because the last photo is from my island in Croatia. Tourists go home. It's not about tourists, we are all tourists here at the moment, so we don't still want to go home. However, why? Because one of the bad side or negative side effects of tourism is also this, that everyone wants to rent their property to tourists and not to students, not to residents, because tourists will pay more. So this affects our coastal cities as well. So it's one of the issues that we have to stress out. We have our policies. They are European policies, and you know, sometimes it's very nice in these agendas, in documents, in policies. However, the problem always is about implementation, and also it's not everywhere the same situation. Some areas are affected more, some less. Also, there are some other problems with, especially in local communities. Sometimes you have also high level of corruption within local communities, where people from building sector, they are pressuring politicians, and then they sometimes change spatial planning, and it doesn't favor the people who have problem with affording their housing. So there are huge challenges in front of us, and this is also, as I said, one of the topics that must be addressed better even in EU-CONEXUS community. So thank you for your attention.
Thank you very much, Anica. You have seen that only with 4 different points of view around Europe, we have focused in very, very relevant issues, a challenge that we have, and especially that affect all of us. You have said very clear, you know, the case of Spain. I could say all the Mediterranean, maybe this could be really affected, but not only on that, maybe also in other parts of Europe, this happened the same. Okay, now I would like to start the debate and also making some questions. You know, it has been interesting, Cristiana, this what you have said, living organism, the cities as a living organism, something that is alive, that is changing, that uses energy, that is also absorb and release energy, water, whatever, you know. How do you think that this understanding can help for the design and build environment to respond for these adaptive and resilient urban systems? How do you think this concept can help on that?
I think that one of the, let's say, starting from metabolism itself, or a system, a living system, the human, the occupant in the building. We have our thermoregulatory system, so we have sensors, we have a system that optimizes our own way of functioning, which is the thermoregulatory system, and then we have procedures to adapt ourselves. We put clothes or whatever decision we make. So this is how we should also consider the buildings. We should put sensors and in the cities as well. We should put sensors in the cities to feel what is happening. Then we need to have good optimization systems like building management systems to make it work as it should be. And then, of course, we can have active systems like active envelope, which receives solar energy from the sun to use, and so to act, to adapt even better. So this is how the cities should, let's say, should be seen, as we need to check all these points. We need to have sensors, and we talked a lot about digital twins, which rely a lot on data and how we collect data from the cities. But we also need to have those networks of assets, energy assets between buildings in order to function properly. So now we need to not think about a building like an inertial thing that only requires energy, but can also produces energy, and they can give energy whenever another building might need it. So we need to balance this energy flow inside the
this
city.
We could say that maybe could be like use nature-based solutions, you know, for such as building, and then also integrate it with the people. This is not like a photograph or a picture. This is like a movie, you know, on all that. Okay. Well, Vilma, I will ask you about in your experience on the port of Klaipeda. How could be all this vision align to implicate all the people around the city, you know, and also align the port development with goals like public health, quality air, public space. This is complex.
Yes.
How do you try to work on that? How do you start it? You know, because it's not easy. There are many elements around that. There will be the port, you know, who plans, who has the money. You have, but then there are many actors around that, and this is like on this living organism, you know, in Klaipeda, could be quite difficult to manage all of them.
Yeah,
what is your experience?
And it's difficult. It's
difficult.
Hard,
Yeah,
actually.
this is very complex.
You have to admit, yeah, that's difficult. But you know, if you want to run this topic, and if you see your vision, and on different, including different parts of the players, let's say, so you see your mission that you are a part of all the ecosystem and all the sustainable growth of the city as well. So you are only part, and somebody has to lead it. Somebody has to take the lead, or the city, country, and in our case, it's the port who takes the lead and puts all together different parties, as you say, on the table, urban planners, researchers. That's important part. And even being in this environment, in this EU-CONEXUS, it's important to know what are the main researchers, let's say, what are the data modeling about all of those things. So, and you take the lead to hear all the parties. You are, and who builds the trust? Trust is built when you are open and when you share. And yesterday I heard a perfect idea. We are so focused on doing, but we are not focused on explaining what we are doing. So I think we have make a lot of interactions to the communities, explain what we are doing. That all those spaces, let's say, it's going to be a lot of constructions, like to build a new terminal, it's a lot of constructions, and people are unhappy. But if you talk them and then tell them that it's going to be spaces for you as well, for cultural events, for pedestrian areas, not only for tourists, but it's going to be bicycle roads, and you will be closer to the city. And yes, it will increase your, you know, rental prices. And that's not the main target, but etc. So that explanation, collaboration, it's what the port, our authority believes. And somebody has to bring everybody on the table.
I think probably also in your case that you were before on the mobility agency of the city, you have a point of view from the city that now can help on the port. That's why maybe because normally in my experience I have seen that it is important how are the relations between port and city and how these are organized. In some cities around Europe, the port belongs to the city. That's probably more easier. But in some cases like here, for example, you know, in Spain, the big ports belongs to the national government. And the city is there next to that. And then they have different structures. And this is more difficult, how to make an agreement with all these bodies and that. But they should. That's why maybe I think this is a very complex problem, but it will be really very interesting, all your experience on that, for how maybe we can move forward on that. Byron, how can that help the local climate planning here, for example, you know, or maybe in a city like Limassol that maybe can afford similar challenges on that?
Yeah. In Limassol we have the problem you have described, because the Port Authority belongs to the central state and the city is the municipality, etc. Sometimes it's like the port and the central state is something else. It doesn't belong to the community. So we need to change the mentality, especially in the relation between, firstly, the public bodies. We need to set up specific goals and understand that these bodies are for the benefit of the society and to serve people. So they need to cooperate and don't act sometimes in their own frameworks and directives and KPIs. For example, the KPI of the Port Authority should be to grow, okay, but also the city needs to grow. So they need to compromise in some areas. But I'm very glad to comment that despite this fact, in Limassol now, and our university is working closely with the Port Authority and the municipality in order to change the hot iron procedure for the maritime industry, for the maritime sector of the city. So a very innovative strategy for reducing emissions from the port. It will be applied with the cooperation of the municipality, and this will benefit pollutants and emissions that would cause diseases or other impact on the citizens. So gradually, I think that we can find the way to achieve these goals, but it's essential what it was said before, the two things. The first is the data. We need to monitor, to observe, to have sensors, to know the data, of course, to interpret the data and deal with the data, but also disseminate and discuss with the local people, because they have a huge force sometimes. They can drive the change.
Anica, how this social aspect in cities like Zadar, you have mentioned this displacement of residents, that maybe they are taken out because they come in new investments, you know, for tourists, whatever. What are the most visible impact, social impact on that? Well, you make a very interesting question. Do we have the city that we wanted to have, you know, and for who? You know, that's why, how this is in the case of Zadar.
Okay, as I said, there are different practices all across the Europe, but particularly in Zadar, I can talk from the local experience. Zadar is a small town with 70,000 people, and it's very touristified. The problem is that now tourists are actually everywhere within the town, and you don't have residential areas and separately
tourist areas, even though they are defined by the spatial plans. But practically in residential areas, we also have tourist rentals. So the problem is, for instance, today it increased the prices for a local population, and it became very, very difficult to buy property or even to rent property. In Croatia, particularly in Zadar, for instance, the price of 1 square meter, if you want to buy it, it's 5,000 euro per square meter. And our income, according to latest statistics in Croatia, is about 1,400 euro per month netto wage. So it's very low. So this difference is getting higher and higher. You know, our standard cannot follow the increase in prices. In Croatia, we were lucky, I would say lucky, even though some people would say it was not a good idea. But we mostly own our own places. Actually, we are at the top level in the EU when it comes to owning the properties. 91% of Croatian people, they own the property where they live in. And it's okay for those generations now, but what about younger people? What when you have to transfer from one city to another city? We also have one other record in statistics in Croatia related to EU, that our children, they don't leave their homes like Scandinavians with 18 or 19 years. Actually, they stay with us the longest in Europe until 35 or 36 years. We cannot get rid of them. Why? Because it's not, I mean, we love them, but we want them to have their own lives. And it's very difficult because they cannot afford to go somewhere else. This is a huge problem for younger population, especially. So,
you know, this is interesting because, you know, maybe we have been focused a lot of effort in technology. We have been focused a lot of effort on infrastructure. And then we see that the problem is that our young people cannot have a house.
Yeah.
And even, we are not working a lot for the vulnerable people, you know? That's why, probably that's why we make some contradiction in what we are doing. Then my question is, if we wanted a sustainable development, this is sustainable?
No.
Probably not. Probably we are not doing right things. What do you think on this concept? You know, we have very clear that this is not only technology, there is not only infrastructure, there is relationships also. And also it will be important to include on the equation people. How do you see this, maybe? Cristiana, how do you see maybe, how can we implicate all those people that have something to say, at least, I cannot buy a house. What have you made?
First of all, from the experience I had at the beginning, we work on very technical projects, fundamental research, let's say, then some were applied. No implication of the people, the end beneficiary, let's say. And after, when we started to implement larger scale projects, which involved cities as well as partners, we were in the phase where we need to put at the same table also the citizens, to interact with them. And for us engineers, it was a very weird step to, to start. But in the end, we saw that this co-creation, because we talk a lot about co-creation and co-design, it was an important step, so that the citizen will actually feel that he participated in that concept, and in the end he's somehow the owner of that thing that resulted in the end. And from my perspective, this ownership process of the community, it's very important. And also, if we translate it into technical aspects like energy sharing happens at the community level. It should be, let's say, centralized at the community level, decentralized from the building level. But from the city level, sorry. But this ownership should be implemented at this community level, so they can actually feel that they are a part of this energy sharing system, and they should put together what they have, these renewables, for example, technology that they have, in order for their neighbor to benefit from this. And this is when we really need to start understanding how people are thinking and how to involve in the process, because without them, we will not succeed in doing anything.
Yeah. But let me to be a little critic on that.
Yeah.
You know, in my experience,
Yeah.
this is what it is needed.
Yeah.
But then, who is community? And I can say to you, I don't know if it happened the same. I would like to know your opinion, Byron and Vilma. Sometimes you ask the community, but maybe there is a small association that only represents 5% or 2% of the people, but the rest of the people of the city, they have no voice. And then probably we have a wrong information, and most of these people are influenced from political issues. That's why maybe then there is not a real society. That's why we wanted to hear the real society. What are the problems? What do you think about that, Byron?
Well, I think it's critical, but now we have more tools, for example. When we prepare KPIs for a project, we have dissemination reactions, how many people reacted. So the agencies that are dealing with projects need to be, they should oblige to engage people, and if they engage people, then the project will benefit and they will get more funding maybe, or we need to find this sort of mechanisms so that the agencies, they would have the duty to reach more people, to reach vulnerable people, to reach the community. And now with the new European Bauhaus, that a lot of initiatives started, inclusiveness is one of the basic principles. So we need to conceptualize this and put it in the task and in the project management processes and make it a formal demand. This is my opinion. Coming from all this we have discussed.
That's great. Yeah. That's great. And Vilma, how you manage this in the case of
actually,
Klaipeda that is
I
complex?
agree with my colleague. It's very important to announce all your projects, even visions, even ideas at the very beginning. And what we are strong in social media, really, and LinkedIn and the Facebook, and we try to reach all the community groups, I would say, not only those small, who are against something, or protecting something, you don't know what they are protecting, maybe themselves. So, but as far as you are open, let's say, and at the very beginning stage, you are more successful. Not to get all those claims. And what we done in mobility agency when I was not in a city, let's say, but in a capital, we organized them. For example, if we want to make a bicycle road, or we want to make some scooter places, let's say, that's a huge problem now in Europe. So we collect all that community for a discussion and receiving a feedback on our idea, and letting them all, even doing many interactions, not only one, announcement, but many of them. So you have to be proactive, I would say.
Yep.
From such kind of agencies, you are who have to be proactive. Not community will come, we always will come with some claims.
How was I'm curious about how was the feeling of the new cruise terminal at the beginning?
Sorry to interrupt you, but I would like to give the opportunity to the audience so that they can also ask their questions. And if you don't mind, we can just start the turn for the audience.
Okay, great. Let's go.
Thank you. Thank you very much for all. I have a question of curiosity for Anica. How you approach tourism related issue in your discipline? How you approach your different question in your discipline related to tourism?
Yeah, within geography, we have tourism geography. And we have tourism geography within the geography as one of the fields, and what interests us as human geographers is
actually this: what is the impact of the tourism on the local communities? So we have a different kind of research about this, and someone asked even in an earlier panel, what is in your panel actually, where you were talking, they asked what is the purpose or how can we be multidisciplinary within the EU-CONEXUS. So this is also one of the approaches that really needs multidisciplinarity, because you need also psychologists, you need sociologists, you need economists, you need geographers to see what is really going on within the area and within the society. So we do have different kind of research within geography that deals really with tourism. Also, spatial planning is one aspect that the geographers are really keen about. We have that kind of the research, and the latest that I was involved in was about this tourist rentals within Zadar area. Actually, we wanted to see the distributions of this rental with within the city to see how it affects actually the local residents. And what we noticed, and it was really shocking, that even in the residential areas that were built recently in order to help residents to have affordable living because they were subsidized by the government, people were actually buying those properties and then renting them again to tourism. So this is also one of the problems. So you don't have good solutions for that. Sometimes it's very difficult, but this is within the geography. We do perform different kind of the research about this. Thank you.
Hi, yeah. Similarly, piggybacking off of the presentation by Professor Cuka at the end, I was wondering if the panel has any takes, so I would like to hear the panel's thoughts on addressing kind of this vicious cycle that can be created by addressing the climate crisis and implementing climate adaptation strategies, in the sense, in a kind of micro sense, where we have adaptation strategies like green infrastructure that can directly cause gentrification and displacement, but as well in a larger sense in that kind of people will look to move to safer or cooler or more climate adapted places in the future.
So I'm not sure I understood well the question.
I was wondering how we can address the vicious cycle that can be created by kind of implementing
this
climate.
Vicious cycle?
Yes.
I'm not sure.
Vicious cycle. Vicious cycle.
Vicious cycle.
So as we adapt to the climate crisis, that we cause displacement through those adaptation measures.
Yeah, I mean, societies are adapting to changes. We will also adapt to this one. We will have to. We are forced to that. But as I said, touristification, if we talk about this, it's something that really, really affects seriously these coastal areas, and we are not thinking a lot about it. So I think it's an opportunity also within CONEXUS to maybe even connect more with other scientists dealing with also climate crisis and everything else, so we can create some better environments for the societies by the coast. I'm not sure if I answered this question well.
I could add something. I think that gentrification is like carbon emissions. You cannot avoid it. You can only mitigate it, and being conscious of what it is happening, of course, not neglecting, and try to mitigate. But when you invest a single euro in a place, then gentrification forces will start in any case.
Yeah. It will start. It's very difficult to stop it in areas, and we don't have just problem with the increase of tourism and people who want to buy. I forgot to say one thing. Last year in Croatia, this is very important data. 50% of our real estate properties were sold to foreigners, not to local people. So from people from other countries. It's very difficult to manage that. So you can just move somewhere else, probably somewhere out of the coast. But you know, you are the one who, or your ancestors were the one who created this area, who preserved it for such a long time in the history, and now you have to move because there are some other aspects that are actually kicking you out of your area. So I think we have to stop this in some way. And in Croatia, one other thing, we have a huge diaspora. We have people from diaspora coming to country again and buying second homes, and they will always have much more money than we have, and we are a small country, so that's why the influence is such big and such huge.
But you know, this kind of thing also has already happened in other countries. You know, for example, maybe it's not coastal areas, but this happened in Switzerland. You know, they needed to create a law that no one can buy a farm if there is not a farmer. And they have the degree for a farmer. Because, you know, in the past there were rich people from Germany, they came, buy a beautiful farm next to the lake. That's why the problem. And then they build some laws. Could be some ideas, but this is not only a single issue. You need probably to see all around what are all these variables around this complex project. Because I agree with all of you, you know, there are many different aspects, and this is not easy. For that, probably should be important the participation on all the actors, but there are many actors that has no voice. You know, there are many actors. Most of the population has no voice. You know, because there are, in some cases, there are some representation from association, whatever, but they have also their own interest. That's why what is very important, we were working on the knowledge and innovation community, and we were working on urban mobility and also on climate change. And you know, the most difficult aspect is how we arrive to the citizen, to the real citizen, not some representation of the citizens, because they have their own interest. In most of the cases, they were political interest. And then they have like instruction. For that, it doesn't matter what is going to happen in the future. They have an instruction to follow, they follow because they are paid for that. That's why it's very important on all these complex cases, because probably in the case of Zadar, it will be important to ask these people, what do you want to have for your children? You know, maybe. Okay, more questions?
Hello, I am Panagiotis Karountzos from Greece. I live in Athens. I'm PhD candidate in Agricultural University of Athens. I would like to say to Ms. Cuka that you just described the situation of my country, in Greece, which I believe it's much more in worst situations. We can find a house, young people can rent the house. Usually, young people leave house at the age of 35, 36 or 40 or more. You just described my country, I believe. I didn't know that the problem is the same in other countries, such as Switzerland, as you said before. I would like to ask finally, what do you suggest to solve this problem? It's a real problem. It's getting bigger and bigger. Actually, what do you suggest?
Yeah, thank you for your question. And I knew that in Greece it's the same thing. He said at the beginning that we will not be giving solutions here, if I remember. but we can try.
But I ask, not only solutions. We can give solutions, but
this
also.
Is obviously a hot topic because no one has questions for others. Because something we can all relate with. It's not new problem, so I have to address this as well. This is not new. It's something that is happening, especially in Mediterranean areas, for a long time. However, you saw the graph, the increase is huge in the last 15 years, and it will be even larger, it seems. It doesn't stop. So it's a problem that really politicians and economics, they have to deal with it. Is it possible to stop the prices? I think that would be one of the solutions. How can we stop the prices, or can we stop the prices? In Croatia, it's difficult because it's a small market and huge demand. And we know what happens when you have huge demand and small market. So if you can stop it and say, no, the price of the 1 square meter will be this one, then maybe that's one of the solutions. But I don't know in economic terms, because I'm not economist, they would probably disagree with this. They would say, no, it's not good. But I know that in Croatia recently they did the same thing with the prices of some food. They say, no, now so it's possible to limit it. But how would it affect the real estate? I don't know. The other solution is on working on how to increase the income. If you cannot pay something, let's try with income increase. But I think it will be very hard, and now the difference between this is really, really huge. The next solution would be subsidizing the build of the homes that would be used only for residents, not for tourism or something else, but for living, so people can afford it. Maybe government can subsidize. We do have some of those projects, even in a city where I come from. Now they announced recently they will be building 750, I think, new homes for younger people. But it will not solve problems to all of us. And as I said, it's something that spread really across the Europe. I'm not sure there is no one solution. There must be a combination of different ones. And it's very difficult, as I said, in tourist areas because it's something else. We had it in Spain, you have it in Greece, you have it now in Croatia, in Italy. It's very similar. And that's why those countries that I mentioned, as you said, have the young people living with parents for so long. Not because they love us, but because they have to be with us. They don't have their lives. Yeah. It's a problem for younger people. And sorry, if I can just, there is one also thing that I didn't find any literature about in Europe, or maybe I wasn't looking deep enough, but there is a concept of working homeless. Something that we, in Spain, there is a lot, and there is more and more. I mean, I don't have data about this. I couldn't find it. So living homeless is a category that is recent. We didn't have it before. People who are working and they are homeless. They cannot afford to pay for the rent, so they are living in their cars or someone in the tents. This is terrible. So this is total marginalization of the society.
And also you can see that it's interesting, but because this has been happened during the last 20 years.
Yeah.
There is not a very long time. Yeah. This is 20 years.
It's
what we have made during the last 20 years of what?
Nothing.
Probably. And then probably on the solutions, probably there will be not a magic solution for everywhere. Probably will be local solutions. And each one need to find what could be the way. You have a question?
Many questions still, so that's why if you can use, because we are running out of time, so we can just
short.
Very, very short.
Yeah, okay.
Maybe you can pick all the questions and then answer.
We have 1, 2, 3. 3, that's okay? Okay,
so
go ahead.
Yeah, my question to Professor Cuka. It's clear that on the one side you have the community which is annoyed about the dynamics. We have the private sector in a way or another who is happy about this. What about the state, the government? What the position of the state? Are they happy with this? Are they adapting with this? Are they looking for solutions? So
they are looking for a solution, and in each of these countries at the moment they are creating policies. Some of them already created them, but it's difficult to implement it fast because some of those people, they need help right away. They cannot wait for 2 years, 3 years, or 4 years more. So something is moving because I see that there are even more and more research about this topic and more policies created. And I think each country has to do it their own way because each one of the countries in the EU has different problems or different practices and different laws. So you have to adapt to your legislation and then to try to find a way to help people. And it's not the same in the country with 3.8 million people like Croatia or a country with 50 million people like Spain. There is a huge difference. So the problems are even higher probably.
Your question? Next question? Okay.
Okay, so I'm Nina Lončar, professor at the Geography Department as Anica is, and this is more maybe like a general comment and question to all of us. Anica's lecture was who are we doing it for? And I would like to go deeper because I think that our academic community is very focused on to be adapted, the adaptive, resilient, smart infrastructures, and we heard lots of talk, very good examples of development on some higher level. For example, the ports and in the industry. But here we addressed a little bit the question of the common people, and I think that is a problem because many people do not even believe in climate change. Many people do not care because it will happen to someone else. We have a problem on the islands as well. I know in the Greece is the problem because of the tourism. We have climate change, we have increased hot days, we have low precipitation, we have water crisis, we have energy crisis, we will have more and more temperature, more and more air condition, and nobody, I think that we don't have solution how to really raise awareness to the common people, because there are the majority. And you cannot say, please don't do it, if he knows that with another apartment that he will rent, he will earn more money. So I think this is maybe also one of the questions that we can maybe address in some other roundtables in the next months or years, because I think we should try to get all these solutions on the higher level to this very low basic level, because this is the base of our adaptation and mitigation, I think, in the future. Yeah.
Thank you very much. Thank you very much. And your last question? There is a last question there.
Hello. I still want to contribute to the topic on tourism and start also to have an input in the next discussion where I am taking part, because you mentioned that mainly tourists are guilty because of the rising of the price, but actually we are in European Union already under a few waves of migration, and this is also one of the case that the prices for rents and houses are increased so highly in most of the countries. So I don't think so that tourists are only guilty in this case. Yeah. So migration and which is still considering, and now Croatia is also the country which is taking migrants, not only sending migrants. That was when you started to join EU.
Actually Croatia, after so many years, finally have the positive migration balance these last few years. Due to tourism, I have to say again, due to tourism again, because we need a working force. Because Croatians emigrated out of Croatia, we lost 10% of our population between last two censuses. We were a recorder even in that statistics. And now we have a lack of working force. And tourism is growing. We need most of those people who are coming to work, they work in tourism sector. Again, so of course it's not just tourism. There are other aspects of economy that are increasing prices. But to us, I think tourism is a problem because in residential areas, in coastal cities, because we are talking about coastal cities in EU-CONEXUS, tourist accommodation is everywhere. So our students, if they want to study in Zadar, they have to leave their apartments on 1st May because tourists are coming, they are paying more. So there are many problems that are coming from this, and I don't think that we talk about them enough. But it's very complex, you're right there. It's not just that.
I would like to know, because usually if you want to adapt a building, to be more energy efficient, you need a lot of money. Many buildings are inhabited by very elderly people. Those people, they cannot afford it. And temperatures are rising. Here in Valencia, for example, they are saying that by 2050, it will be impossible to live because the temperature will be so high that we won't have it won't be able. So I wanted to know if by enforcing laws and also involving industry, even if it's with laws or because we can also raise the taxes that they have to pay, that would be part of the solution.
Yeah, of course, it is a matter of involving the authorities at this level, since energy efficiency it has a price, and this price cannot be afforded by anyone. So that's why this is when the incentives and the legislation must get into the scene and start supporting those citizens who are vulnerable enough in order not to afford this. Vulnerable not necessarily from the economical point of view, but as you said, elderly people who have different health problems. So that's why we need to see what are the active solutions that we can use, PV systems, heat pumps and so on, but also some other complementary solutions like nature-based solutions, which can be involved in the city and should be part of the city. It's huge step to start with, and we don't do that. We just, when we rehabilitate one building, we just put PV panels and that's it. We don't consider the green, which is also a very good starting point for us. So yeah, the authorities should step in for sure.
Thank you, Cristiana. You know, well, I would like to give a final message on that. Let's go to close. We can continue speaking then later, you know, with the speakers. There are many things to say here, but you know that it is clear that we have not speaking about technology. We have been speaking about social aspects of this development and how this is important on that. But I would like to give a positive idea and also a good news, you know, that on this complex, difficult environment, especially on the coastal areas, you know, we could say that the coastal cities can lead the way toward just and receiving future. And the time to act is now. And this will depend on all of us, especially on CONEXUS. This is a good example that this debate could happen, must happen here, you know, and we need to try solutions. We don't have the solutions, but it is clear that we need to involve all the partners here, all the people here, and not to have only one vision of the problem, you know, because these are complex problems, you know, that has difficult solutions, and probably the solution will be in each single place. That's why maybe let's go to work on that. Thank you very much to all the speakers. Thank you very much to all of you.
Well, good afternoon, ladies and gentlemen. It's always challenging to moderate session after lunch. We were lucky that they didn't serve wine this time, because otherwise you would get sleepy. But anyway, to entertain you, let's start with the fairy tale. Once upon a time, coastal cities were celebrated by their beauty and prosperity. Today, they're starring in the very different story, the one where floods, migration, and social stress play the villains. But as in every good story, we are the heroes if we agree on the plot. So today, let me introduce our storytellers. So, Amy Allen from Southeastern University, Ireland, Lucia Dimitrov from FredU University, Cyprus, Yaroslav Dvorak, Klaipeda University, Lithuania, Vicente Elmer, the local one, Catholic University Valencia and University of Valencia, and Stephanie Mikulec-Perkovic, Department of EU Funds, City of Zadar. Myself, I am Gerda, Professor of Finance and Sustainability, and recently Sustainable Finance as well, from Kaunas University of Technology, Lithuania. So let's begin our story. For that, I will invite on the stage Vicente, who will tell us how local governments manage in good or bad ways with recent floods last year experienced here in Valencia. And then we try to develop our narrative to the end of this fairy tale, hoping it will end with Eva, how it's finished? Eva happy or yes? Okay, Vicente, please, the stage is yours. Welcome.
Thank you very much for the time. Okay, I want to tell an story. Is I don't know a point of view of what is the one reason for the situation after the rains in this last year. I think there is one factor that we have to consider. The factor basically is the risk, and in this case, the underestimation of the risk of these catastrophic events. What is the reason of that? The reason of that is because if you consider that it's impossible to happen one thing, you don't decide to adopt measures in order to avoid that. It's possible to talk about two topics. The two topics are the floods in Valencia and the forest fires. I am going to focus on the second one, the floods in the Valencia area of October 2024. It is not the first time that this phenomenon occurs in our region, because as you can see here, there was a huge flood in Valencia, in the city, here, in this place, for example. In 1977, there was another disaster with floods in the Alcira, the Ribera, in 1982. And finally, on October of the last year, there was the famous Damna, and it was the last event in this order. I want to specify one thing. Is the floods in this area is a recurrent phenomenon. It's not a new phenomenon, these rains, but as you can see here, these occur in the variability of place and temporal mark, and it is a different magnitude, and it is the reason because you can consider that a rain is not a danger because there is not a flood after this rain. But sometimes there is a high intensity in the rains, and there is an area with a flood. In this point, I want to insist in that you don't consider that there is a risk, you don't decide to prevent this or mitigation for this phenomenon. And this underestimation of the risks, the consequence is that the decision is to ignore this question, and sometimes, sorry. From the public administration, this phenomenon of non-consideration of the risk is a fact. This is an example. There was a plan for a renaturalization of the new river. The new river is, I have to explain it, the old river is now a garden, is very near here, but in the 60s, there was a plan with a huge construction of a new river bed in Valencia. It's a dry river bed, but after with the last October, this construction was a reason because this area where we are now here, it avoids the consequences of these huge rains. But in the other part, on the other side of this construction river, the river bed, there was the famous floods in Valencia. Well, 5 years before, from the municipality, from the government of the town hall, they decided to renaturalize this space. And the architect, the responsible of this new project, said that, as you have here, major floods only occur every 200 years. It was a mistake because 5 years after, there was this important floods in the Valencia area. It is this underestimation of the risk, in this case, the risk of the floods. But another reason, because these catastrophic events may occur, is because sometimes, as the theory of is not here. No. Opa, sorry. Here. Following the Limburg theory, as you can see here, sometimes the decisions, the policy makers decide to adopt the decisions with the principle of model throw. The idea is not to try to find a solution for the problems. The idea is to, I don't know, to adopt decisions for the short time, not for the long time. In this case, I can mention an example. The example was about this clean off of the ravine, the famous Barranco del Pollo, and it was only for 400 meters in this clean off. If you consider the extension of the area, it is a very short actuation. And as we can see after the disaster, this short option, this short action, it wasn't enough for trying to avoid the disaster. It was necessary, maybe, a bigger infrastructure in order to avoid this disaster. And finally, thank you. Finally, I have to insist that sometimes it is because there is a problem of short time, short term, because as the public choice says, the important for politicians sometimes is the short term and not the long term. It's very important the long term, the short term and not the long term, because you can spend money in decisions, in plans, in actions in order to obtain more votes in the elections. And this kind of infrastructures, if you don't consider the risk, you don't want to adopt these infrastructures, because it's not these structures. With these structures, there is not a profit in the short term. And it is a problem, in my opinion, in order to avoid or in order to fight without the climate change and the policies of mitigation and of this climate change. No more. Thank you.
Thank you, Vicente. So, in Vicente's presentation, he focused on how climate risks, particularly floods, are systemically underestimated in urban planning policy. And now, I invite on the stage Stephanie, and she brings a practical municipal perspective, emphasizing the importance of trust building, transparent communication, and citizen engagement. So might be this solution could help also us to be more resilient. So please, the stage is yours.
Thank you very much. Hello everyone. I will really try to be on time. I hope it will, all the pictures that I put will not be too busy, and I will try to explain everything in this short period. So this is the city where I come from. So it's Zadar in Croatia. So floods are also a thing that we are experiencing. Sometimes in the last few years we had a big flood, 2017 I think, that made a lot of impact on the city. But maybe later about that. I will talk today about a few projects regarding the information, engagement and trust building with the community. So in the panel before us, I think someone was mentioning how we are all focused on doing things and not explaining things or translating them to the community, to the users that we are actually providing this information for. How many of you are known or know the term of participatory budgeting? Have you heard about it? Yes, some of you. Okay, so I will not go into a lot of detail, but this is one of the tools that we use that have in their own sense of financing elements that are connected to the sustainability and to the environment, which are public lighting, bus stations, green areas, pedestrian areas, sports equipment, street workouts, so everything that is in the urban space that kind of reflects how community uses the space. Why did I put this here? Because we had a specific strategy of the communication and engaging with the community on this project. The first one was we published a call. We took proposals from the citizens about the projects they would like to have implemented in the 37 districts that we have in the city. And then the most important thing, we held public forums. But public forums where all the proposals were presented to the citizens of that district, and they were deciding on the activities by those proposals what they want to finance. This is one element. The most important element was the fact that on each forum there was a mayor or deputy mayor and all the head of departments of the city present with us on those public forums, so community could come and ask all the questions they wanted to ask and give the information back to the city, not only regarding the topics that were being discussed. This is why I put this here, because this element of presence of the public decision-making participants is very important on the field. The second project I want to talk about is a project called Inclusive Play. This is a project that we were doing a sensory park, which is a public park, 24 hours open, designed for children with disabilities. Why did we put this here? This was park co-designed with the experts that are dealing with children with disabilities every day, with their parents, with their brothers and sisters, and with the community that they are involved in. They came with us on the meetings with the architects to change the project that we have developed and to make it custom-made for themselves, because in the end, they are going to be the users of this space. The element of sustainability or environment protection here is also the input that we have given to the architects, which is we are giving you this part of the land, and in this part, no tree or no bush can be taken out, and you have to manage the project within all of these elements that are already in the field. So this is another way of us communicating with different type of stakeholder, but also engaging a community and gaining the trust of the parents of the children with disabilities, which are one of our most vulnerable groups. The third project, I will just go through it because I am almost out of time. So the third project involves also participatory budgeting, but it is connected to the element which is specific for Zadar, and that is that we have in our administration area also 8 islands. 7 of them are inhabitable, have citizens on them, islanders, and 1 doesn't. But what we also did was, on the time that in the week that we are coming to the island, we would publish on the website and on the all social media channels. We would publish that we are coming, so the citizens, which some of them during the day also live on the mainland because they work there, but on the weekends they go to the island and they are a part of their community, so they know we are coming and they can also come and participate and say what they want to say to us, how they want to design the island area that they live in. I'm really going fast through this because I'm trying to stay on time. This is another project that is, I think, a lot of cities today in Europe are focused on this, on planting more trees, making all the cities and urban areas more green. But why is this important? Because this is one of the projects that we have. We put all the projects on social media, but it's not only social media that we use and not only digital tools. But this is one where we had the most, let's say, visible element where our stakeholders that really care for the green areas in the city, where they are present. And they are present on Facebook, believe it or not. This is the platform where we get insights of their age, of their let's say, activities that they are doing and so on. But for example, I put besides this a TikTok, because video is today one of the most important means of communication with the, especially young people, because of the attention span. But what is really interesting is that the video that related to this element, which is really important for the audience on Facebook, is almost non-existent for audience that is on TikTok. Oh. So this was one of the elements that was, if we had set all of our campaign and all of our information to the TikTok, it would not reach the audience that we wanted to reach and all the community to give feedback. This is another project. I will finish with this, and maybe later I can give more information about everything during the questions. Yeah, just 30 more seconds. This is another type of us targeting a specific stakeholder. This started as a wide range element in the project, and it turned very narrow into young people. We have had a project that was a live project. It's called Living Streets, that was focused on transforming parking spaces and parking areas into spaces for people. This was 2016 when we had this project, but it was very little project with a budget of 50,000 euros. But what we mainly focused on was defining a tool that would engage our community, and what we were thinking at that point was we needed an urban community-led festival. So we used culture, NGOs, all of those elements to bring the community to collaborate with the city and to bring back the life into this neighborhood, because at that time, the city, which the building, which is now the youth center, used to look like the picture here. So it was brownfield area that we knew we were planning to renew and rebuild for the young people, but this area had no lighting. It was really not secure for people to move around the neighborhood. And what we did was make two messages. One is this, Život je u kvartu. It means life is in the neighborhood. And this was a call to action, or our message that we were sending on every poster, on every media element that we had. And this happened for years until we came to the infrastructure circle close, and then we changed it, or we moved it forward to because neighborhood is people. So this is now what we translate to all of our citizens, because the people in the neighborhood are now what is designing all the activities that are happening there. This is how it looked this year. I will finish with this. I will say no more words about this, but this is the project that we spent basically, maybe I will say 300 euros to market, but everyone knows when to come, where to come, and to give feedback to us through different workshops and everything that we have arranged with NGOs about different topics each time, whether it's mental health, whether it's environment, whatever. Okay, thank you so much.
Thank you. Thank you very much, Stephanie. And this is very much correlated with what Amy Allen will now present, how community can be engaged also in festivals. But Amy has two very interesting examples to share with us about problem solving and how climate change is not an environmental issue, but also the social one. So please.
Thank you, Gerda, and Stephanie, don't worry, I'll make up for the time that you took. I'm really delighted that Gerda has chosen a storytelling presentation, so it makes us easy to share our experiences, and again, just to thank everybody here from the perspective of your openness and the sharing of your experiences and your knowledges across all of our EU-CONEXUS family as well. So yes, I'm part of SETU, and I'm based in our smallest campus in Wexford. So my stories are going to be very localized and close to me and to my heart and to different things I've been involved in as part of the campus as well. So I guess my interest is very much driven by social sustainability, and just to remind ourselves, in a way, what does that really mean? What is the bottom line? It's about improving well-being for everybody, creating opportunity and cohesion amongst our communities as well. And we're all facing times of change and different pressures from climate, political, etc. So it's a very stressful time, a lot of different migration patterns that all of our countries are experiencing, etc. So I want to approach this under a few pillars or areas that I think work with the projects that I'm interested in, and hopefully you'll have some small takeaways from that as well. So, gosh, I just have realized that I think I need to get my eyes tested because I actually can't read there. So unfortunately, I may have to look back here a little bit. So there's a few pillars that I'm going to focus on in particular. So equity, inclusion, community resilience. I'm also looking at cultural continuity. So we're going to have a little talk about festivals again. So again, leading on from Stephanie, and participatory governance too. So I guess the case studies are together showing what institutions can do to foster social sustainability. And the first case study I'm going to look at will be education-based, and the second will be more political government, local government-based. But when we're focusing on social sustainability, it's about ensuring all of our groups have access to the resources they require, to decision-making opportunities, co-creation opportunities, as some of my colleagues have mentioned already. And within some communities, there is an evident gap or lack of accesses to particular resources, and we'll consider that as well, particularly from an educational perspective. And one of the key things in terms of social sustainability is maintaining our current culture preservation, that whole sense of place, but also there's an evolution occurring. So how do we bring in our newer communities and maintain but evolve that sense of culture and be inclusive as part of that journey there too. And so again, just that notion of ensuring that our communities are involved in some of the direction or the creation towards all of this. So my first case example is a program that we ran through the Wexford campus, which was focused on a particular community which we would serve, which is the fisheries and aquaculture businesses. And we found through working with other state bodies and through liaising with representative agencies that many amongst this group were had quite a strong level of skill sets, but had not any previous history or comfort level, indeed, in participating in third level education. And in that sense, they were kind of being left behind to a degree. So some of the challenges that we faced as part of this as educators was, how do we create a program that suits the type of industry, their requirements, but also their working structure, because of seasonality, because of what weather conditions they may or may not be called out at particular times. And this program was a blended approach. So it was delivered online and in person, and all the program was recorded. And that allowed for the flexibility to respond specifically to the needs of the individuals who would undertake this course. As I said, it kind of responded to what was traditionally an underrepresented group. And our hope was to build capacity. They had the skill set, they were doing it, but they had no recognition for what they were doing. And so we looked at things like management, marketing, new product development, ideation, all of that sort of thing. And again, the opportunity to network and share information was a big part of the program there as well. So from our perspective, we felt it contributed to the sustainability of the coastal businesses and their opportunity to respond to change, to advancements in technology, and just to improve their overall sense of opportunity in the sector there as well. So, yeah, the main, I suppose, output or lesson I want to share from this is that it is important to engage with the local, the representative bodies, the different sectoral groups when considering the needs of the programs we develop that respond to our areas, our local areas as well. The second case study, is very different. So it's a festival. Within Wexford, we were very fortunate to host for the past 2 years what is probably the largest cultural festival in Ireland. So we have a population base in our municipal area, so within our town, of just under about 25,000 inhabitants. For this festival, over the 9 days, for the first year in 2024, 600,000 people came. And in 2025, this year in August, over the 9-day period, 800,000 people were estimated to have attended this festival. So this is a great example of how local government can become involved in supporting sustainable communities, because they undertook the role of managing, planning, liaising on this festival, and also in terms of recruiting the volunteer workforce, the people who would make the festival and generate the experience for all of the festival goers. And this worked very well because they ran a very successful orientation period for volunteers to allow them to train them to clarify the types of roles. There was the opportunity of co-creation in terms of defining what the volunteers felt they could contribute to the festival according to your interest and level of experience. And this was a body of roughly 700 people coming from throughout Ireland, but also our newer communities. So some of the immigrant communities also were involved in this. And it was a great way to build social cohesion and a sense of sharing of the culture that we were very proud of course. So again, some of the takeaways from a social sustainability perspective was that volunteers actively shaped the festival. They shaped the experience, they contributed to the roles and to, how they would be part of making this such a success as well. So just to finish up, I suppose why we're here and why we discuss all of these issues that are of interest to us and share the little, for me at least, I would say, knowledge that I have is to, I guess, figure out what should we be doing in the future, or where do we go from this point. I feel that to continue to integrate, the marginalized communities, be those fisher people, fishermen, women, etc., who are involved in that area and industry and who feel that they're slowly but surely being kind of reduced in opportunity. The people who work or volunteer in our community, including them in decision making, in developing opportunity is key. Upskilling is always something that we need to be considering, both our capability and capacity from a tourism fisheries perspective as well, and just making sure we maintain this place, a sense of place and community, that we build and evolve our culture to be inclusive of all there. So I think that's the themes that have been coming through from all of our panelists as well. So I hope you've taken some little learning from that and appreciate your time. Thank you.
Thank you very much, Amy. And I think you finished with this very nice idea that integration, even in volunteering within festival, which might seem some far away from ecological and social problems, but it's not, because one of the major risks that was mentioned in the World Economic Forum 2025, the Global Risks Report, was involuntary migration. And involuntary migration might be caused by environmental issues, political issues, and economic issues. And it's not so easy to cope with those issues, especially as in your case, you mentioned how environmental change would impact fishermen's communities, right? If in that case, with lower employment or higher unemployment, we have migrants on top, so we face even bigger social crisis. And that's why now I invite Jaroslav Borak. He will share Lithuanian cases experience on how in Lithuania we dealt with the Ukrainian refugees who also join labor market as well. So please, the stage is yours.
Okay. Hello. It is great pleasure to be here in Valencia, especially that the topic of our session is engagement and stakeholders engagement, because when I first time came to this university, we actually also worked with a project on student engagement, so we are continuing the topic with engagement, but from a different perspective. And like already Professor Gerda mentioned it, that my exercise today to speak about migration. And I want to start with some facts. First of all, today 80 million of people are considering as migrants. So it means that if they all join together to one group or one state, it will be the fourth state according to the population. And I don't know if you know, but what do you think if we're considering EU-CONEXUS project and universities, what are the top 3 countries who are getting more migrants, the biggest amount of migrants? Huh? Question to colleagues.
Absolute numbers or relative numbers?
Spain is on 3rd place, but it's top 3. Huh? Top 1, top 2 still are 3. Germany is the 1st, and for sure France is the 2nd. So all 3 countries, they are attracting the biggest amount of migrants, and especially if we are talking about phenomenon of migration, it's really it really creates a lot of discussion on that, because first of all, migration, it's about, like it was mentioned, it's about sometimes economical pressure, because people choose to move due to some economical reason for better life. And also people, like it was mentioned, can move for better life due to the climate change. And for sure, it's also very important that if there are some problems inside of communities, sometimes people moved because they are not able to live in community and they are looking for better conditions. It can be even internal migration inside of the country. And sometimes, luckily, and all states are interested in that people who moved from the country come back. So we have the phenomenon of return migration when people come back home. So sometimes we are even not ready to take them back. So we must to prepare to adapt to this. And nowadays, migration is especially important topic after the war in Ukraine started, because a lot of people from Ukraine left their homes and moved to other countries. And my 2 stories about Ukrainian people and what is the situation and how we responded in Lithuania. Because in fact, usually migration, it's an outcome of something what happening. Is it economic wars or war or something even climate change and etc. But for sure, it's immediately create another outcomes for or impact for local societies. And first of all, in case of one, just shortly introduce the situation how Ukrainian immigrants start to move to our country, and you can see that the biggest amount of people, like in most of Europe, came to European Union after the war started. And usually the first front line which are meet with migration, it's a local government. It's migrants, for sure, in different cases, they are coming to coastal cities either through the sea or through the border, because coastal cities like Mediterranean and Greece and Spain and Cyprus, they all know what is flow of migrants, because they already felt that when people from Syria, from Africa moved, and they were those front line. In case of Ukrainian people, we were just those who trying to help those people who are run due to the war from their homes. And yeah, local governments here, one of the first place that affected, and here is one of the research where we actually consider it not only Lithuania but in Croatia, and we look how local governments react on this. And what we can see that local municipalities, they are key players in addressing refugees crisis, and they can create different innovation policies and strategies. So in this case, different top-down state refugee policies limit local innovations relevant for refugees integration, because local governments, they are more flexible in this case. They can create different tools to help those people. And especially what is important in both cases, networking with NGO, so participatory governance that already was mentioned, and our stakeholders, they are key factor that to help in the beginning, especially for those people who leave their homes, to get first aid, first directions, what to do and how to do. So here you can see different drivers and how different local innovations work in case of migrations through different networks like vertical, horizontal, and specific innovative practice for refugees integration were created in different countries like language learning. And for example, our university, Klaipeda University, especially involved in language learning of different migrants group and especially support for Ukrainians. And I think that most of universities participated in such kind of missions. So just can say by finishing this case that emotional solidarity due to the war in Ukraine influenced all local actors. Networks of NGO and municipality played a significant role, and local networking fostered innovative service delivery, especially employment and housing support, because most of municipalities provided housing for people who came, and even still now, when we done this research, some municipalities inform that they are still providing housing for some Ukrainian people. The next case, for sure, it's an important one, because when people are coming, they are interesting where they can work and in which area. And next case is explaining that people, and especially in Lithuania, even from Ukraine, they started to come as even before the war, but one of the main industry in Lithuania is logistics, because we are one of the best in Europe. We have a lot of companies which are managing big truck numbers, and for sure we need different a lot of workforce for this huge number of machines. And it's also very good that we can say that Ukrainian drivers, they're usually highly skilled, they have good work ethics. It's because of very close cultural ties between our nations, and this is also very good for integration of people. When you have close ties, they are part of common history. If you are not familiar, you can read about Lithuanian Grand Duchy, where you can find that Lithuania, Ukraine was in the past the part of the common state, and for sure we have common past from Soviet Union, so we know each other. And yes, in this case, unfortunately, when we are supporting from one hand of Ukrainian people and even drivers or other, but from our perspective, all these efforts also not very effective. The drivers declare that we are also exploiting them. We exploiting migrants, and they are meet with different type of discriminations. So it's not only about case of drivers, because I have made also some focus groups with other Ukrainian groups, and ladies also mentioned that. And even if we are talking about more broader, for example, this summer we discussed it with Kazakhstani ladies. And they also were mentioned that, for example, they were invited to come to work in Lithuania, but after that, when they started to work in some companies, they immediately got negative feeling from locals. So nobody is trying to integrate them in common working collective at the companies. And just after the manager mentioned it to local Lithuanian people that they come because we are Lithuanians, are not interesting to work with works, they started to create some common ties. So we are first asking people to come, but we are not really interested that they will help us. And finishing, I think, the things that were mentioned, we can say that we must have some public policy solutions, especially that in case of migration, that we help to reduce discrimination for those people who are coming. We must to teach language them. We must to help with family integration. It's not the worst that people or migrants, it does not mean that Ukrainians or no are coming to your country. The worst thing is that they are not working, and they are not after that paying taxes, and they are not interested in this case to create something better for well-being of the community where they are living now. So the last two lessons from all these cases. First of all, from case one, we can learn that migration drives local social innovations. Municipalities and NGOs co-create solutions in housing, employment, and services. Integration builds emotional solidarity and strengthens urban resilience. And it is very important to strengthen municipal flexibility, to fund inclusive service, to connect newcomers with long-standing residents. And from our case, we can learn that migration sustains coastal logistics and economies, but face systemic discrimination and weak institutional protection. Integration is hindered by language barriers, informal economy practice, and exploitation risk. In this case, we must ensure fair labor standards, provide language, family support, and enforce protection against exploitation. Thank you for your attention. Hope it was useful.
Thank you very much. And now I would like to invite Lucia, because we were discovering all those villains, right? Like floods, migration, and social impact. And Lucia will wrap up, because each of those aspects influence our psychological well-being, and then how people perceive those changes. And what about resilience? What are the options for us to be more resilient? So please.
Yeah. Hi everybody, I'm happy to be here. Thank you for letting me participate in this very, very interesting conference and session. Coastal cities, so often celebrated also for their culture, for their diversity, for commerce, for connectivity, are increasingly marked by negative things, such as economic precarity, social marginalization, and psychological distress. So, as someone who has studied resilience in Mediterranean societies that are deeply or have been deeply affected by economic and social upheaval, I have basically seen firsthand how coastal communities suffer and how inevitably they adapt. Today I will address how seasonal unemployment, poverty, migration, and climate change converge in these urban and coastal environments, with particular reference to our Mediterranean basin. Southern Europe's coastal cities, especially in Greece, Cyprus, and Italy, have experienced significant strain in recent decades due to a convergence of economic fragility, climate vulnerability, which has already been mentioned by Vicente as well with the paradigm of Valencia last year, and demographic shifts. So once thriving hubs of commerce, tourism, and seasonal employment, many of these cities are now grappling with the long-term effects, basically particularly after the Eurozone crisis of 2009. Nobody has ever recovered from that. And in particular in Cyprus, the collapse of the banking system in 2012. These shocks led to persistently high unemployment and underemployment rates, especially among youth and women, creating a ripple effect of economic insecurity, social fragmentation, and psychological distress. So our research in Cyprus in particular found that young adults between the age of 18, we even went up to 45, especially women, individuals without a college education, and those with prior experiences of anxiety, were the most vulnerable to depressive symptoms, generalized anxiety, and long-term stress. These are not just economic outcomes, obviously. These are profound psychosocial phenomena, and by Jahoda's theory of latent deprivation, employment structures not just income, but time, identity, and social connections. Coastal regions in the Mediterranean have become primary gateways for irregular migration, further complicating the social fabric. In Greece, Cyprus, Italy, the arrival of asylum seekers and refugees, often fleeing terrible wars, often fleeing conflict, often fleeing poverty, or even climate-related displacement, has placed disproportional pressure on housing, healthcare, and education systems. So frontline communities like Lesbos in Greece, Lampedusa in Italy, face rising tension and ambivalence caught between, humanitarian solidarity and the perceived erosion of local stability. This layering of socio-economic hardship with sudden demographic changes creates what we might call a compound risk environment. Migrants often arrive with extreme trauma biographies, while host communities experience resource strain, cultural anxiety, one may say, and diminishing trust in institutions. So, from a psychological risk perspective, three categories emerge clearly. One is individual vulnerability, such as pre-existing mental health conditions, low educational attainment, or financial dependency. The second is contextual risk, including unemployment, institutional fragility, and urban overcrowding. And the third is relational risk, social isolation, perceived discrimination, and a lack of meaningful peer or community engagement. So, to understand the dynamics of unemployment, migration, poverty in coastal cities, we need to go beyond economic or demographic indicators and examine psychosocial systems at work, those that either expose individuals to greater harm or equip them with tools to become even more resilient. Psychological resilience, as defined by Zvjezdan and colleagues, refers to positive adaptation in the context of significant adversity, in the context of challenges. But resilience is definitely not an individual trait. It's not something that we have or we don't have. It is a systemic process shaped by relationships, by resources, by values, by institutional support. So our research in Cyprus and Greece during successive waves of crisis, economic collapse, austerity, and the pandemic has focused on both risk factors that undermine well-being and protective systems that foster adaptation. Findings, international resilience research by Unger, distinguishing between rugged and internal assets, such as, for example, motivation, and resourced external supports, such as community systems. So globally, we see promising initiatives, and Mediterranean cities are experimenting with mental health programs, green urban design, and digital interventions. However, progress is uneven, and it's slowed by underfunded systems, corruption, as well as institutional distrust. So resilience must come from internal assets, motivation and hope, and resourced external supports like inclusive schools, fair labor, accessible and quality health care, and a fight against corruption. In response now to the intersecting crises facing coastal cities, economic precarity, climate change, social fragmentation, governments, NGOs, and academic institutions have begun to mobilize a variety of frameworks and interventions. How? For example, we ask, how do we move from policy to practice and from theory to transformation? So globally, guiding frameworks such as the United Nations Sustainable Development Goals, especially Goal 11, Sustainable Cities and Communities, or Goal 13, Climate Action, and the New Urban Agenda call for the creation of inclusive, resilient, and adaptive urban environments can be a framework for change. So, these frameworks basically promote equitable access to services, participatory governance, and protection for the most vulnerable. Yet, their implementation remains inconsistent. And especially in the Mediterranean, where many coastal cities are still recovering from the Eurozone economic crisis, responses have been slower and even more fragmented. So while emerging innovations and resilience strategies offer promise, we must confront the structural and psychosocial obstacles that continue to undermine both individual well-being and community cohesion in coastal urban environments. In sum, the problematic landscape of today's coastal urban environments includes underfunded mental health systems, informal and insecure labor markets, unmanaged migration impacts, and profound psychosocial vulnerabilities masked by the appearances of resilience. So, the problematic landscape of the things that I have mentioned before needs to acknowledge that resilience cannot remain a buzzword. We cannot be going up and down and resilient systems and resilient this and resilient that. We have to turn it into a policy outcome. So we have to start thinking of how we can move forward. And the Mediterranean coastal cities face some of the 21st century's most significant social challenges, as mentioned before. And the good thing is that, yes, we're facing a lot of challenges. However, there is also some threads of resilience basically in communities, in families, in the human capacity for adaptation. Therefore, in order to move forward, we're not looking into economic reforms or climate adaptations. We're looking about building systems that nurture psychological resilience, restore trust in institutions, and renew the sense of belonging. This is the task of governments, basically, of educators, though, as well, researchers, and each and every one of us in this room. So the challenge before us is not only academic or policy-based, it is human. How do we create cities that protect not only livelihoods, but also the invisible architecture of hope? And I will leave you with that question, and I will thank you for paying attention and for listening to my talk. You're welcome.
Yeah. So you saw our storytellers really told you very different stories from very different angles, reflecting very different heroes, right? Bad or good guys. So we have around 20 minutes left, right? So since I saw from previous sessions that in today's conference, and this conference audience is quite active. Nevertheless, I have a list of questions for panelists. So maybe we have questions from the audience. Yes, please.
I have a question to Stephanie. So I'm interested in knowing more about the details of implementing the participatory budgeting model in Croatia. So would you please give us some more insights in regarding the participants? Are they really representing the different groups of the community? And would you also please give more information about the percentage of the financial resources available for participatory budgeting? How many % of the total fund of neighborhood planning is really available for this model? Because I think this is the most important point when it comes to participatory budgeting.
Yeah, thank you for the question. I put on the slide the first pilot year that we had it, so we had a relatively small... Okay. Everything's fine. We had a relatively small budget at that point, but what we, it was around, I think, 500,000 euros in total. I don't know at this point what was the percentage, because our budget, our city budget, really is each year very different, because we have a lot of funds that are coming from the European Union projects. So each year is very different. But what are the key points I would say here that we learned is the fact that we need to have a separate participatory budgeting in 3 areas. So specific allocation for the mainland and the districts on the mainland, for the islands because they have completely different needs than the mainland, and for young people. So this is all different things that we need to, in the next iteration, discuss and decide how much of the city budget is going to go in different areas. The important thing is that the citizens, all citizens, were able to participate, and it was the citizens that were in the end on the public forums and deciding what they wanted to finance. It was not city, it was not city officials in any way. We were there sometimes for 2-3 hours until they have reached the decision what they amongst themselves in the neighborhood want to implement for the city to do in their own, in their name. Yeah.
Yeah, but again, I mean, it's clear that everyone is able to participate.
Yes.
But who really participated at the end? Because
it was elderly people, it was representatives of the NGO, it was representatives of the younger people, anyone could come, teachers from the school, whoever was in that neighborhood, in that district. We didn't say to anyone, this is the only stakeholder that can come or not. What we learned is that we need to also target more young people, because when we looked at everyone who came, it was the young people were the least represented. So this is why we want to have a separate budget, especially for them. But one of the things that was important was also the delivery of the message where the forums are happening. So because the population in different areas is more aging and it's more elderly, we couldn't use only, for example, digital tools. So we printed posters and then we put them in front of the stores that they go to buy groceries every day, bakeries, pharmacies, and so on. So everywhere where we can give the information to the stakeholder that we wanted to target in a certain way. Yeah.
Can you repeat what was the budget?
Sorry?
What was the figures for budget?
No, it was really small, like 500,000 euros. Or a bit 600,000 euros. No, for the total of, for the total district. Yeah. But we're small. We are 70,000 people, so we're not that big.
Yeah, but it's not very small. Even not in my city, but we have Klaipeda district, which is about something like this. They have 100,000 euros, and like they have also different budget for some areas and for municipality. So, yeah. but maybe for sure money.
Yeah.
The whole budget is meeting.
So the next question I have is for all the panel members. My question is, how do we shape our message so we don't get just dismissed as woke culture? So on LinkedIn, on social media, on the projects we want to push forward.
Could you please repeat the question?
My question is for everyone in the panel, so I'll be happy to take different options for this. But how do we frame messages so we don't get just dismissed, on social media and so on by younger people as woke culture?
What culture?
Maybe I can give, I think I understood the question. It's never one message. It starts with a lot of meetings, a lot of different stakeholders that are involved, and it takes time to shape the message you want to send. It should never be more than, for example, 3 or 5 in total if you have a big campaign, if I can put it like that. Because the audience has to relate to it. It has to be simple, not long. So it takes trial and error. But once you do a few of the campaigns, you will very, very soon realize is your message going through or not, and is it reaching the right audience, and you have the right to change it at any time. So it's a living organism, as someone mentioned today about the city and the urban planning and the mobility in the city. It's the same here. It changes.
Since it's for everyone, I think each of us might also think about spreading our message. And as for academic society, I think we underestimate also the power of social media. I believe we maybe would not succeed on TikTok, but if each of you try to spread your message via LinkedIn, for example, it really works. And there's no need to repeat what in your scientific paper published in very complicated words, but try to use this channel too, because as we discussed and our previous panelists discussed, also academia is involved in this, and sometimes I think for politicians, for general society, we seem a little bit of distance, as if we do some science and there's reality. So my advice would be use your social media as well, spread the word. I do so, I use LinkedIn quite actively, and I see that in this case you not only post, but you also create this community around you, and then it's easier to connect with people, to write a message, also to agree on the project, even if you didn't know the person before. So that's my angle answering this question, but please also share your experience. It was the question for each panelist.
Okay, I will start with again one of our research. Actually, the Klaipeda in 2020-21 was Klaipeda of European youth, Klaipeda European Youth Capital, and we were responsible for one of the project for which that it will be more successful related with political literacy, and we actually done few surveys on political literacy of yours. If somebody is interested from audience, please join us for future research in comparative perspective actually. And what we found, it's really surprising. For sure, social medias are very important for young people, but what is important also family. Family and their parents, they form a lot of political attitudes of yours. And it seems that what the father, mother say, it's important on their participation actually. If they say that they are like in parliament stealing money and for corruption, so it means that it's they are creating future culture that those youth will be not active in different even participatory budgeting, etc. So we must a lot of to work also with parents, still, and create trust in communities. And also, in fact, what is also one of the issues that in fact youth, they do not know a lot about how local government functions. They can know, because from the school, about parliament, about president, even European institutions. But what is a local government, which provide for them a lot of things, a lot of services, they are not interesting. That they are getting water, they are getting kindergartens, they are getting, because all those services are not for them. And this is one of the issues. They have limited knowledge of that. So social media are good, but parents and also we must work with them, because they are still authorities for their kids. And we see that even when they choose in universities, parents are very important. They say, you must go to this direction.
Okay. Well, I think that in order to get things through, we have to encourage participation. I mean, all these messages cannot be coming from top to bottom. They have to be created by the people, for the people. So if we involve more people into how we write these messages and how we disseminate these messages and what language they want to use, and I'm not talking about just using a language that is not understood by those people that the message needs to address. So I think that it should be involving more participatory actions, something that also increases, number one, the trust in institutions, and number two, it increases people's willingness to participate in these projects because they were created from them, by them, for them. So we're experiencing a lot of trust in institutions, at least in Greece, Cyprus, Italy, that are countries that I'm very much aware of what is going on. And in these cases, what do? I mean, how do you go about convincing people about all these projects, and how do you go about convincing people that what they see in front of their eyes, corruption hitting the sky, is not actually happening? Well, you've got to have them involved. You've got to bring them in, and you've got to sit down with them, and you've got to try and manage their worries, their fears, their mistrust, before you start serving them with brilliant ideas that will never work.
Okay. Vincent, do you have something to add? No? Okay, then Amy, I see you want to say something.
I think it's a really good question, and it's a challenge. And how do you fight the algorithms is my question back to you, because we are faced with so much information, and how do we know what to believe, what is true or not? I guess a lot of my colleagues here have said some of the same points, being very open and clear in your communication to build that level of trust. Maybe as academics to provide the evidence to support our arguments would be there, but it's the channels we choose. Something like LinkedIn, you mentioned, Gerda, so that kind of fights the algorithms to a degree, but who is engaging on LinkedIn but maybe like-minded individuals again? So I honestly think it's a huge challenge, and I don't have the answer, unfortunately. You know, I don't think there is
we need
an
to
easy
use
answer.
all possible ways.
Yeah.
LinkedIn in one way, then Facebook in another, TikTok. It was disaster for me. I couldn't manage that. But among us, we have younger generation who is able to use. So I think it's complex. You can't have one. We need to ask marketing people, and they will say us how to communicate. But somehow I believe that from academic society, we are more concentrated on academic conferences, scientific messages, and it's really we need to speak simple words about complicated things, but know how to translate it to bring the message to wider society. Okay, 6 minutes left. Any last questions from the audience? Okay, then I will ask to share a wrap-up slide, if possible, for technicians. Yes.
Still questions.
Okay, no problem.
Okay, maybe I can add just something. I think it's very important because it's not easy to serve all the networks. I mean, there's a lot of information today, but it is very important to be consistent, and it doesn't have to be perfect. It needs to be simple, in simple words, short and consistent. So whether it's once a month you want to share what you have done as researchers, what are your findings, and then give the information or a link to documents and to evidences that you have used in your research, that is a great opportunity for the one that is actually seeking that information, because someone is always seeking the information. Everyone has different fields of interest, and someone will need your information. It's not easy. I go always from my point of view when I try to find something. It's not very easy for me, and I am not a researcher, to find the things that I want to find in research papers. I come to a lot of obstacles, and as the time is a very important resource today, if I can't find it pretty quickly, I will move on.
Yeah.
And that is the reality. So everything you can do to spread word about what you are doing, because we are doing the same in the city level. There is so many things that we do every day in all different departments, but we every day need to be present and pick the information that we want our citizens to know. The same is here in all the sectors.
Okay, thank you very much. So to wrap up, in our today's fairy tale, we had several chapters of this fairy tale. So mainly political decisions that shape vulnerability, right? Then we discuss local governments, how they can build trust and resilience, and social sustainability depends on inclusion and cultural continuity. Then migration challenges especially require integrated community-based responses, and it all affects our psychological well-being, and which is central to long-term adaptation. And with that, I hope that we'll have a happy end of this fairy tale and live happy ever after. And with that, thank you very much for my distinguished panelists. Thank you, audience, for your patience. and have a nice day.
Thank you for chair.
Thank you.